Good morning, everybody, and welcome to our Insight Day for Podiatry, aimed at users and community for the armed forces. My name is Paul Chapman. I'll be your host for today. But before we start, if we could just go through some of the housekeeping as we go along. You can see in front of you is a message just to remind people, if you could keep your cameras off and your mics on mute while people are presenting. There will be opportunities throughout the event for whereby we will invite you to switch cameras on and join in any discussions that go forward. But while people are presenting or you're watching the videos, could we ask you to keep your cameras and mics on mute? The chat is open and it will be available for you to ask any questions should you wish to do so as the event goes along. And also what we will be doing is posting within that chat environment any links to any information that we may talk about. It's a way of communicating with the presenters and the team and the experts going forward. So what I would like you to do is just to enjoy the information that we are going to give to you today. Hopefully you will find it helpful to help navigate your way through the world of podiatry. Next slide, please. So, as I said, my name is Paul Chapman. I am a physiotherapist by background, but what we want to do today is give you an oversight into the world of podiatry. Now, as I say, this event is aimed at the armed forces community, and what you will see today is there are individuals who have moved from an armed forces career into that of podiatry, and what I hope to do is give you the breadth of and the width of professions that are available within the area of podiatry. The event will give an insight to what podiatry is. It will talk about how to become a podiatrist, and we have colleagues from the universities on the call, so if you wish to discuss with them about how you would navigate that, then you can engage with them a bit later. What we will also be doing is hearing from podiatrists, those podiatrists who had an armed forces career. And what we want to do for you is to give you an insight, an overview of how they became a podiatrist after serving within the armed forces. Next slide, please. So as I say, what we plan to do, as I say, this is the agenda. This is what we will do as we go along. We do plan on having a 10-minute break, and what you will see there is individuals who have a wealth of experience in the world of podiatry. Next slide, please. So why are we asking you to look at podiatry as a career? Well, podiatry is a brilliant career opportunity for anybody who is interested in joining the healthcare setting. Now, I am a physiotherapist and I've worked very closely with podiatrists, and you understand that the work that they do is vital in the support of lower limb integrity, biomechanics, etc. I'm not here to talk about podiatry because I'm not a podiatrist, but what I would do is I am here to talk about why we consider you within the armed forces are ideal individuals to look at as a career of podiatry. We know there's a lot of evidence out there that individuals from the armed forces do pick up health careers, and podiatry is one of those. And as you can see, there's a little poster there of a podiatrist, and that is an individual who has done a career change. Now, they haven't career changed from the armed forces, but what they've career changed from is somewhere else and taken podiatry as the future career they want to move forward. Now, you may be at the point where you may be considering leaving the armed forces and looking at it as an alternative career. What we will do today is we will talk about those transferable skills. We'll talk about why people pick up a career in health, but also why those individuals want to work in that setting, what they're able to give, and the opportunities that are available for you. Next slide, please. Okay, so let me just talk about a group of individuals, and podiatry is part of that cohort of individuals. Now, if you become a podiatrist, you will join a group of individuals, a community called Allied Health Professions. Allied Health Professions are made up of 14 individual professions. Within the NHS, there's around about 350 careers, and AHPs are 14 of those careers that are available for you. Now, if you really want to be picky, you could say there's 15, because radiography is split into diagnostic and therapeutic. Allied health professionals, and this applies to podiatrists, you're registered practitioners, and you have to be registered to be able to practice and use the protected title of that of podiatry. There's also, and they are registered with the Healthcare Professions Council and the General Council of Osteopathy. Being an AHP, and that particularly as of a podiatrist, means that you're an autonomous practitioner, which means that you can work on your own, you can work in isolation, but you can actually work in a number of sectors, both the private and the public. Within the NHS, the allied health professions combined make up the third largest workforce behind doctors and nurses. So what's unique about being an allied health profession, or in this case, particularly a podiatrist? It means that you can assess, diagnose, treat and discharge patients. You're not dependent on other people doing that for you. You can make these clinical decisions. That's why you're autonomous practitioners. It's possible, and this applies to podiatry, to manage a patient's care from birth to end of life. And hopefully you'll see that later when we meet some of the podiatrists we've got lined up for you. The aim of any allied health professional, particularly a podiatrist, is to maximize the potential of any individual's life, to allow them to live life to full and live activities to allow them to achieve that. Within the sector of AHP, there's many professions, the 14 I talked about, but also it's broken down. I'm going to learn about that with podiatry later. There's many sectors within the podiatry environment. It's very similar to that within the armed forces. You can work both as a clinician and a non-clinician in the world of podiatry, and you're going to learn about those individuals, and we're going to meet some individuals from the universities who are podiatrists, from academia, from the clinical, and from leadership as well. Within our AHP world, they're also supported by non-registered clinicians. So if you don't want to go down the registered route and qualify as an AHP or a podiatrist, it is possible to be the support mechanism within that and be a support worker. Next slide, please. So this is the 14 professions, and they're all flashing up in front of you, and they vary from that of art therapists all the way through to the technical end of diagnostic, therapeutic radiographer and ODP. As I say, there's 14 of us in total: physios, dietitians, operating department practitioners, orthoptists. There's music therapists, art therapists and drama therapists, occupational therapists. And there's also paramedics. But more importantly, we're here to talk today about our podiatrists. And he is the little guy there in the green with a stethoscope around his neck, holding a Doppler, which is a machine which is used by podiatrists going forward in the treatment of patients with lower limb issues. Next slide, please. So as I said, the allied health professions is a group of individuals very similar to that within the armed forces. And what you have within your armed forces is you have your army, your navy, your Royal Air Force, Marines, etc. Similar applies within the allied health profession. So you'll be an allied health professional overall, but you may be within a specialist profession. And for example, on the slide here is dietetics, but what we're going to talk about today is podiatry. And you then may be a specialist within that area, and similar to that within the British Army, you might be within the Regiment of the Royal Engineers. Next slide, please. So what we're going to learn about today is why you could become an AHP or a podiatrist. And as you see from this slide here, there's many skills that you already have that you are using. I'm going to learn about those later from colleagues who are going to be able to tell you what skills they brought from the armed forces into that of a career of podiatry or as an AHP. But as you'll probably see, you've already got your command, your leadership and your management and your team working skills, which are very transferable and used by our AHP colleagues within the sector in whichever they work. Next slide, please. Okay, so that's me and just giving you an overview of what it's like to be an allied health professional. What we're going to do now is we're going to hear from one of our colleagues, one of our podiatry colleagues, who is a member of the Royal College of Podiatry. And Emma is going to talk to you about what it is to be a podiatrist. So over to you, Martin. Thank you. Right, so what I would suggest we do there is, because we're having some technical issues, we'll let Martin work on that. Should we go to the next slide and we'll introduce another colleague from the Royal College of Podiatry. And this is Lawrence, and I've known Lawrence for quite a number of years now. And Lawrence is a classic example of somebody who was in the armed forces and then has gone into the world of podiatry. And what he's going to give you is an overview of the general routes to become a podiatrist. So thank you very much, Lawrence.
Thanks, Paul. Morning all. Hi, my name's Lawrence Ambrose. I'm the Head of Policy and Public Affairs at the Royal College of Podiatry. I qualified about 20 years ago, and previously I was in the Royal Navy for 4.5 years, from 88 to 93. So I'm just going to briefly go through the 3 routes to go into the profession. So in England, every country is different because healthcare has devolved. In England, there are 3 main routes into the profession: apprenticeship, undergraduate, and the pre-registration masters. Each route offers a different pathway to becoming a registered podiatrist, but all lead to a professional qualification and registration with the Health and Care Professions Council, which is essential in order to practice. So first off, the undergraduate BSc honours degree as the traditional route involves studying for an undergraduate degree in podiatry, typically a Bachelor of Science honours at a university. Full-time course lasts for 3 years, 4 years in Scotland. Some universities may offer part-time options over a longer period. Students engage in both study and clinical practice, covering topics such as anatomy, physiology, pharmacology, pathology, biomechanics, and theory of podiatric medicine. Clinical placements are in NHS trusts and are a key part of the degree to develop hands-on skills. In England, students can apply for government loans to cover the tuition fees and living costs, and on qualification you receive a Bachelor of Science honours degree in podiatric medicine and can then apply for HCPC registration. Next, and those are all the schools that offer it, and 4 years foundation for those with an asterisk. Now, next slide, please. So, the new apprenticeship route has only come into fruition in the last few years and is gaining in momentum. As a podiatry apprentice, you would be it's work-based training where you earn while you learn. You're generally employed by an NHS trust and spend time learning on the job whilst also studying through a university. It typically takes 4 years to qualify as an apprentice, and apprentices split their time between practical work experience and academic study, which at the end of the 4 years would lead to a degree in podiatry. The apprenticeship is structured to develop the necessary skills, knowledge and behaviours to become a podiatrist, with assessments throughout the course. The apprenticeships are funded by the employer, meaning the apprentice doesn't pay any tuition fees. On completion, apprentices qualify with a degree in podiatry and are then eligible to apply for HCPC registration. There's less places that provide the apprenticeship, but these are increasing all the time as the apprenticeship becomes more popular. Next slide, please. The third route into the profession is through a pre-registration masters. So this is an accelerated route for graduates who already hold a degree in a relevant subject, such as biology, physics, chemistry, or health sciences. It's an intensive course designed to provide the necessary knowledge and clinical experience. It typically takes 2 years full-time. The course combines advanced theoretical study with clinical practice, preparing students for the podiatry profession, includes extensive placements to ensure graduates are equipped with the practical clinical skills, and the funding is through, you may receive postgraduate loans to cover tuition fees and living expenses. And on qualification, you earn a MSc in podiatry medicine, and can then apply for HCPC registration. So, next slide, please. So you can use the UCAS website to convert any of the qualifications to use your current qualifications into UCAS points. So this just gives you a breakdown of how many UCAS points you need to get onto each course, and that link will show you clearer. So each of these routes offers a clear path into the podiatry profession, specifically in England, but we'll also hear from Scotland later on, and it allows flexibility depending on your individual circumstances, qualifications, and your career preferences. Thank you very much. And please go onto our website, rcpod.org.uk careers, and that gives you all the information about all the schools that provide the degrees in the apprenticeship. Thank you.
Thank you, Lawrence. Thank you very much. So what we've learned there is that there are various routes into the world of podiatry, and that what we can do is that it's important that you probably investigate with the universities what opportunities there are. I think, as we say to all our colleagues looking at a career as an AHP, you'd be surprised what you've already got in your toolbox to help you take forward. And I'm sure, Lawrence, you would agree, it's about looking at what you've already got, what you're able to do, and then mapping your route going forward. Right, okay. What we're going to try and do now is we're going to try and play the video again, but one of my colleagues from my end is going to try and see if they can do it. So, Rob, do you want to see if you can play the video from our end? Because we've got a copy of it. Again, right, it's fingers crossed. Yeah, fingers, toes, and eyes crossed, and let's see what happens. So over to you, Rob. Thank you.
Hi and welcome to the Podiatry Insights Day. My name's Emma McConaughey and I'm a podiatrist. I also work here in the Royal College of Podiatry in the Press and Communications team. Now, I'm sorry I can't be with you live today. I'm actually in clinic and I did have to put my patients first. We're very, very busy in clinic at the moment and had to prioritise their healthcare. So I do hope you'll forgive me for doing a pre-recorded message. So first of all, congratulations on coming along to the webinar and taking the first step in potentially your new career. I started my training 25 years ago and I have never once regretted my choice to go into podiatry. I actually wanted to be an optician, didn't get in, best thing that ever happened to me. So you might be thinking, what is a podiatrist? Now hopefully you've heard of us before or you know a little bit about it, but in very simple terms, a podiatrist is an expert of the foot and lower limb, like a dentist is of the mouth or an optician of the eyes. We have a huge scope of practice, so whether we're in NHS, private, independent, working in a sports team, in the Ministry of Defence, in a prison, on a cruise ship touring the world, any of the number of numerous places that podiatrists work, we have quite a large scope. So we will basically deal with any issue in the foot and lower limb. Now, you might associate us with, oh, that's who I go to for my verrucas or my ingrown toenail. And yes, we do all of these things, but we also do so much more. So just like the dentist maybe does the checkup on your teeth, but they can also do your complex surgery and diagnose all of your different issues in your mouth. We can do the same for the foot and lower limb. So we'll see patients who have everything from foot pain to maybe joint problems. They might have concerns about their foot health. They might have a wound that needs treated. They might have a sports injury. They might need minor surgery on their feet. The possibilities really are endless, because at the end of the day, most of the population's got feet and they only get one pair of them, so they're probably going to have problems at some point. Now, one of the big ones that you've probably seen in the press is things like diabetes and how that affects the feet. Well, globally, we do have 1 foot lost to diabetes every 20 seconds, and here in the UK, it's roughly 200 per week. Now, as podiatrists, we work very hard to prevent that from happening. We work towards early interventions to try and save those limbs, because sadly the chances of a survival with a non-trauma based limb loss, where it's something like a disease through heart problems or diabetes, the statistics aren't great at 5 years, and we really are about improving people's quality of life. So we will treat people from cradle to grave. So you can be seen by podiatrists at any age. We see children, paediatric podiatry, and that might be for developmental issues or foot problems that might come up. We see them right through to end of life and palliative care as well, and everything in between. So chances are probably one of you has had a foot problem at some point in your life anyway. You've maybe even seen a podiatrist for one, which is a great way to learn a bit more about the career. But today you're going to hear from a huge range of people, many of them ex-forces personnel themselves, on why they chose podiatry and what they found that it offers their life. For me, I've been 25 years since I started my training, and for the past 20 years I have run my own business. I now employ a staff of 12 in central Scotland, and it's given me the flexibility to choose the lifestyle that I want. I work in clinical practice a few days a week, and I work for the Royal College of Podiatry the other days. And I have a young child as well who has disabilities, so I have been able to set my lifestyle to the way that I need, and it's provided a great amount of flexibility for me, as well as, most importantly, job satisfaction. I enjoy every day at my work. I might have 14 patients in a day who could all come in with the same problem, but they're all attached to different people, and the connection that I've been able to have with my patients over the year, it's second to none. I've been very, very fortunate that I've seen some patients for 21 years, and to be able to be part of somebody's life and their healthcare journey for that long has been an absolute privilege, and one that I hope to be able to continue for quite some time. So, please do listen to all the lectures today, listen to the scope of what's there, and I really do hope that you consider podiatry as the next step in your journey. And there is jobs out there, tons of jobs. I have many jobs here in Stirling if anybody ever wants to come up. But yeah, you're pretty much guaranteed a job when you leave university. The student I've got here, she's in her final year. I offered her a job on week 2 of her course. So you shouldn't have any problem finding a new post once you've qualified. So best of luck, enjoy the day, and hopefully 1 or 2 of you I might meet as qualified podiatrists in the next few years.
That's great. Thank you very much. And we finally got there with the technology. Right. Okay. So I think what we've learned so far is from Emma is that you can see how passionate podiatrists are. They are individuals, and you need to undertake a period of study to do that. And I think both Lawrence and Emma have given you the idea of what podiatrists do and the variety of things that they have to offer as a clear. Oh, we started a bit early with something else. Right. Okay. What I'd like to do now is I'd like to bring some colleagues who are from an armed forces background and have a chat with them. And hopefully we've got on the call, we've got Emma, Ian, Saul and Derek. So if you want to switch your cameras on, and we'll bring down the slides deck, and hopefully they've arrived. I know some of them have had some technical issues trying to join going forward. So if we bring down the slides deck, and so hopefully I've got Emma, Saul, Derek and Ian. And good morning, Emma. I know it says you're there, Christine, but I know you were sitting on Christine's computer. So we just thought we'd confuse the audience a little bit. Is Derek there as well? Yep. See Derek and Ian. Is Ian there? I don't know if Ian's arrived yet. And I know, Saul, you've arrived, but because you had some issues with the link, we do apologise again. You're here, the most important. Right. Let's crack on anyway. So what I'd like to do is, again, this is, I think, for our audience, I think we'd like to understand why podiatry, and then how you got to become a podiatrist. I'm going to start with Emma, because Emma, I think you are actually a student studying at the moment. So would you like to give us a little bit of a background on what your past career was within the armed forces and why podiatry. Why did you want to study as a podiatrist?
Yes, certainly. So I originally was in the Royal Navy as a physical training instructor. I did 13 years there. And I got to my halfway point and I've got a young family. And so the physical training side of it, I appreciate obviously the lower limbs and how they work and why we need them. So I looked outside and I was like, what can I do outside, which still has the structure of bits of the armed forces. So then there's the offer of the NHS afterwards, as long as I'm successful. There's also the private practice side. You can combine the both. And so I enjoyed the idea of the structure and also going out and being autonomous on my own. And then I looked at the financial side of it and I could use my ALCAS, which those that are in the armed forces, I don't know if you're aware, if you've not got a degree already in the armed forces, then the armed forces will pay for your tuition fees. I also wasn't educationally qualified. So whilst I was in, I did my access course. So I did that alongside working. So then I'd set myself up ready to apply for university. And then I could seamlessly, as long as the university accepted me, I could transfer over and start the university course, which I'm thoroughly enjoying, and it works really well with my young family. It's Monday to Friday. Those that are in the armed forces know it can be quite, you don't know where you're going from 1 minute to the next. So it kind of worked for our lifestyle that we needed. And then it's got such a broad scope of practice. You can literally go into anything. So whether it is the wound care side, maybe the MSK, and they all kind of merge in because you need one and the other to work well, which I'm learning currently. So yeah, that's a bit about me.
Brilliant, Emma. Brilliant, and I'm pleased you talked about the LCAS and then the Learning Support Fund, because funding is always a question we get asked from everybody. How much is this going to cost and where's the money coming from? But we can talk about that a bit later. Right. I'd like to bring in now Ian. And Ian, again, where were you within your armed forces career and why podiatry?
Well, I'm going to give you a little bit of a spiel because I'm now 19 years postgraduate. So as having studied podiatry, so I specialise in musculoskeletal side of podiatry and I work in private practice. So to answer the question about the army, I did 5 years in the regular army, initially as a combat medical technician, and I worked with 19 Air Mobile, which then became 16 Air Assault. So I then became a paratrooper. I then ended up working with MedTroop when it was about 12 people. So I was the SF support medic for the last 2 years of my career in the army. But when I was looking to leave, I took a private careers interview. So I didn't use the army one. I did a private one. And after the first two suggestions was that if you leave in the army, maybe you should think about the RAF or the Navy. So what I really wanted to be was a specialist. I'd done the medical side of things. I'd been winging it with various different routes for a few years. And then I wanted to be a medical specialist in something. So it offered me optician, it offered me physio, it offered me occupational therapist and podiatrist. What the hell's a podiatrist? So I thought the best thing to do was I took a placement for a day with each of those professions. And I, for example, didn't fancy being an optician, sitting in a dark room every day, just going, is that better or worse? So I liked doing the podiatry. I did some surgical, I did some routine. And then we saw the breadth of practice, which meant that I could do, because it's medicine as it pertains to the lower limb, there are specialisms from wound care, as you've heard, diabetes, rheumatology, MSK, and the link between all of those, or you can be, really build long-term relationships with your return patients. So I picked podiatry because I didn't have to do any more A-levels as well. That was quite handy. So I selected Huddersfield University because it was had the best rating at the time and the lowest house prices. So I could, I'd have a bed sit in Southampton, or I could go to Huddersfield and have a 3-bedroom house. So I had a study and all that kind of stuff. So I would advise that when you choose to do podiatry, not if, but when you choose to do podiatry, you see university as your phase 1 and your phase 2 training, right? You're not going to come out of the factory as a top-notch whatever. That's the start of your learning journey once you've graduated. So I took a job in my second and third year as an assistant practitioner, essentially kind of to get some of those bone jobs out of the way to start with, because you're going to have to, you know, earn your skills. So I was an assistant practitioner in nail surgery. I was an assistant in the MSK department, but they also had me sat in a room going through old paper records of people who died 10 years ago to try and like get rid of the backlog of the admin side of things as well. But it gave me a lot of experience and, importantly, in my case, networking. So I found during my university time that I had an aptitude for the biomechanics bit. So I thought I might go into surgery or wound care, having come from a sort of trauma background, but I found that I was particularly adept at doing the biomechanics side of things. So the application of mechanical principles to the human body to try and work out if they've got a dodgy knee and the scan says it's okay and they've done all their physio treatment, why is it still hurting? So we're there to sort of really work those sort of things out. So I've spent a career basically following my aptitude. I've got to build the job that I want. So out of uni, a bit like Emma was talking about, there's quite a lot of opportunities, even straight out of uni, if you're willing to take them. So I was headhunted to go to work for one of the companies that makes gait analysis equipment. So part of biomechanics, you might watch someone walk or run or do things like that. So there was fancy kit that allows us to do that, but they needed someone to interpret the data. So using my brilliant skills of winging it that I'd got from the army, I was put in front of orthopedic surgeons, physio departments, podiatrists, osteopaths, all sorts of different health professionals to allow them to add biomechanics and gait analysis into their thing. So everything from elite football clubs to research projects, labs at universities like Salford. In 2008, I started my own business. So I wanted to forge biomechanics in the way I thought it should be done. And when you start your own business, shockingly, no one gives you any money to do that. So I rejoined the Army Reserve. So I spent 13 years in the Army Reserve as a physical training instructor alongside growing my practice. So having my own business allowed me to go to Nepal with the Army and Cyprus and all, you know, a lot of funky stuff. But I've managed to basically build my practice. So now I've been doing that since 2008. What's that, about 17, 16 years. So now I see some elite sports people, but a lot of my patients are 90-year-olds who want to walk their dog, you know, keeping them healthy and well as possible. We liaise with lots of other types of practitioners. I lecture in biomechanics. I consult with the orthotics and manufacturers. So orthotics are little bent bits of plastic you put in your shoe to try and change the way you're walking. I managed to build a lifestyle business around what I want to do with the world. And I also even have, with the lecturer who's on here later, Jill, started a national campaign to raise awareness of certain types of foot problems that we don't, you know, so plantar fasciitis, for example, there's 40 different conditions that come under that title. So you've got to make sure you're being diagnosed with the right type of heel pain before we can attack and address that particular problem. So I hope this isn't speaking out of turn, but I'd like to offer the opportunity that I took of placement. So if you are interested in this world and you're looking for somewhere to find out what it is, you're welcome to come to my clinic. We're out in Norfolk. It's called BX Clinic. Take a look, but we'll be happy to offer you a placement and talk you through how you can transition, bring your army skills into the world of podiatry. But that's all.
Brilliant. Thank you, Ian. Appreciate, and probably come back to talk about, and that offer of experience. I know to gain work experience is something that is quite challenging within the healthcare sector at the moment, particularly with the challenges that we're facing. So I think what Ian said there is, if there's an opportunity, then I would definitely take it. All right, I'd like to bring in Saul now, and Saul is the other end. Saul is actually NHS and head of service, which is where, you know, opportunities around leadership and as well as using your clinical skills. So Saul, do you want to give us a bit of a background on where you were within your armed forces career and where you are now and what opportunities there are within the NHS for podiatrists?
Yes, certainly, Paul. So thank you for having me. So I left the Royal Engineers in 2008 after having my final posting with 1 RSME training regiment. Like all military personnel, my career was spated with injuries. And that's how I really got interested in podiatry, having seen a podiatrist, having orthotics, and basically getting me back up and running and mobile when I was in the military. So for me, that's what really got me interested in the military. And similar to Christine, I was actually supported by the Army to do my Access to Science course. That interest for me was really around the MSK side of things, for getting into podiatry. However, I very quickly realised that podiatry is a bit of a ticket to the party. So I graduated out of Salford University, and when I graduated immediately, I went straight to Singapore to work as a podiatrist and spent nearly 5 years there. And I was very lucky that I got to specialise in both MSK, sports injuries, and wound care, so I had a very broad experience. I then came back into the UK to go back to the NHS, where I worked as a diabetes research podiatrist, running clinical trials and drugs trials for people with foot problems. But simultaneously, while I was doing that, I was training to do podiatric surgery, running steroid injection clinics and high-end sports injury clinics. And that for me really did solidify the variability of what podiatry offers. But during that time, I actually got a bit more of an interest in leadership and management. So I started to pursue that simultaneously. I actually left podiatry very briefly to manage a big team of nurses, 100 plus nurses. But it was the podiatry training and my experience in training that gave me that opportunity to do other things within the NHS. I've since come back to podiatry, and I'm now the professional head at Sheffield Teaching Hospitals. And we've got around 60 podiatrists here in Sheffield, ranging from a podiatric surgery team who work alongside orthopedics and vascular, to a very high-end MSK team who do ultrasound-guided injections and manage sports injuries, all the way down to vascular podiatrists, renal podiatrists, rheumatology podiatrists, and research podiatrists. So within our service, we have podiatrists specialising in multiple areas. But what's really important is we've got podiatrists who specialise across multiple areas. So you don't have to be a one-trick pony. You can do anything you want in podiatry. I think the key is just applying yourself to those areas. We have a lot of podiatrists who come from varying backgrounds, not really academic, but now they are publishing papers, writing papers, and presenting at conferences. What I would say is I've had experience of private practice. I had a successful private practice. For me, the biggest draw to podiatry is the ability from an employment point of view to work for yourself, as Ian's described. You can pursue your own private practice. Equally, there is always jobs in the NHS in multiple professions and specialities, or you can go working for other people in private practice. A lot of the staff that I manage, they work both in private practice and the NHS, so they get the best of both worlds, which really does lend itself to a really diverse skill set. What I would also say is there's a lot of travelling involved in podiatry as well. We've got a lot of podiatrists who go to India to the Hansen disease leprosy colonies, going to Nepal and various other places. I think what I would say is just get exposure. My advice would be to different areas of podiatry, because there will be something that you find interesting, whether that's private practice, NHS. And just like Ian said, we're more than happy here in Sheffield to take people if they want to shadow, whether it be podiatric surgery, wounds, MSK. But we also do a lot of apprenticeships now. So my journey into podiatry was through the undergraduate route through Salford University. But we've now got several apprentices who we have taken on as podiatry assistants, who are now doing the apprenticeship with the university, and over the next 3 years will then become qualified podiatrists. So they're getting a different route into the service, but they're getting exposure across multiple areas. So they've got a bit of a golden ticket to what they want to do when they kind of graduate. Ultimately, for me, I think podiatry gives you that opportunity to be really flexible in your career and take it as far as you want. But it also allows you to diversify. My partner's a podiatrist. She joined at the same time as me. She's recently moved after 15 years of podiatry into NHS project management. So it does allow you that to diversify again later on in your career. So it's not just a one-stop shop of I'm going to be a podiatrist for 20, 30 years. It's if you want to do that, great. But if you want to then diversify and go out of podiatry for a while and then come back in, it also lends itself to that as well.
Okay, that's brilliant. Yeah. Thank you very much, Dawn. I'm going to come back again a bit later. Right, I'd like to finally introduce you to Derek Santos. Now, Derek is slightly different, again, podiatrist, but he's going to talk about where his route has taken him. So, Derek, what was your armed forces career, and where are you, and what are you doing now? And I think your sign behind you is a bit of a giveaway, but we'll go with that.
Okay. Okay, thank you so much, Paul. in terms of my journey into the profession, it was in a way of a mix between Sol and Ian. So I'm a bit of a mix between both. In terms of the forces, my experience in the forces was quite short-lived through injury. I joined about 40 years ago, which is, I was told to think about when I joined and left, and it was a long time ago. And to put things in context, when I trained with the SLR, SMG, and as I say, a webbing used to fall apart. We had to use, bungees to hold it together, and it used to get wet and things. If you're not sure what I'm talking about, you need to look back at the history books, So it was a while ago. I was born in Gibraltar, and I left school at 18. I did my O-levels and A-levels. Didn't know what to do with my life at the time, so I worked in a supermarket, and at the time I joined the TA, and I joined the Royal Gibraltar Regiment. I could have joined the air defence. They used to use a blowpipe at the time. I could have artillery 105s or infantry, and I did join the infantry, and I loved it. That was me, hooked on it. I wanted to follow a career in the military. After about a year in the TA, I went to see my recruitment officer, and I went to Limestone. I did my selection there. I went back, and did my training there. And unfortunately, my career was very short-lived. I had a fall from quite a substantial height, injured my back, and my knee took the brunt of things. And I was really in and out of hospital for quite a while. Towards the end, I had surgery in Plymouth, and I got a medical discharge through injury. I left the forces with a walking stick, and I was told I would be using that for probably the rest of my life. And in a way, that's what triggered me, to learn about health at the time. A lot of people sort of move into jobs in security, and I became a security guard at the time, and I worked in an office. I used to lock up at night, walk around, switch the radio on and read. And I started reading about my injury. There was words in anatomy that I could barely pronounce, but it was interesting. And I learned a lot about, rehab. I looked at sort of rehabilitation. I tried some other things myself, and I thought, yeah, I could do this for the rest of my life, as opposed to sitting here. And I did. So now podiatry for me, was something that happened by chance, because after doing all that, I was going to be a physio. And in those days, I went to the library, and I picked up a box for physio, and then next to it there was another leaflet that said podiatry stroke chiropody. So I really came across podiatry, and a lot of people here, and a lot of my students, come across podiatry really by chance, and then they realize, oh, what's this? I could do this. As I read more about podiatry, I learned that it was a very challenging course. I learned that in terms of your scope of practice, you will be injecting local anesthetics. You'll be doing nail surgery, for example. You could even supply people prescribe-only drugs like antibiotics. As I found more about the profession, I learned that you can do things like working tissue viability, working diabetes. You could even, at that time, look into specializing into surgery and becoming a pediatric surgeon. There was routes to rheumatology. My interest was obviously MSK biomechanics, physical therapies, and definitely I could do that as well. So not only could I do what I was interested in at the time, but there was also scope to move into loads of other specialties. And so I did inquire about how to become a podiatrist. And unfortunately, my two A levels, were not science-based. So I had to then find another route. Now, my sister at the time, my sister was a GP in Scotland at the time. We found there was a college, and they had an access to health. Nowadays, you can get access to health everywhere. So in terms of access into podiatry, college and access to health is definitely a route. So I did that. I moved over from Leeds, which when I settled, to Scotland. I went to Dunfermline to Lauder College at the time. Did my access to health. I got the G Mackey Trophy for that, which is like a DAX award. I then started my podiatry journey. I went to Queen Margaret University. I'm still here many years on. So I did my undergrad here in this university. By second year, as I say, my journey was slightly different because I always liked clinical, but somehow I was drawn towards research and academia. And in level 2, when I was in year 2 of my program, I was in clinic and I had a patient. We had to do a case study. We had to choose a patient. And I had a patient that had a green toenail and had an infection. So I chose that, and it was actually Pseudomonas aeruginosa. And at the time, I got a good mark for that assignment, by the way, and my lecturer says, you should publish that. And in those days, it says, go to the library, get this journal, photocopy the authorship page, follow the guidelines, send it away, and I did. And that was my first paper when I was in year 2 of my undergrad, which was a Pseudomonas aeruginosa infection affecting the nail. It was a case study, and that was the title. So that was my first paper, and I was hooked into that. I've heard people talking about leprosy, Hansen's disease. Whilst I was in year 2, Dr. Hugh Cross, had just finished his PhD and had been to India, worked in leprosy, and gave us a talk, and I was hooked into it. I'm one of these people that just loves learning and will always continue. Every day is a learning day. So I was hooked on it. So I says, well, I need to find out more about leprosy. I need to go to India. So I spoke to Hugh, and he put me in touch with Bandarawala Leprosy Hospital in Pune at the time, and also with the Leprosy Mission on Lepra. As soon as I finished my final year exams in level 2, I was away to India, to a leprosy hospital. I spent all summer there, shadowing. The experience I got was amazing. I hadn't really seen ulcers at that point in time, but the experience I got in India was incredible. I was shadowing a nurse, in tissue viability. I was allowed to go into theatre and observe surgery as well, plastic surgery, orthopedic surgery. I also spent time with the orthotists that learned in level 1. Again, Ian spoke about this, about padding and strapping and making insoles. And I could make insoles to offload these ulcers, which were not healing. And unless you offload them, they're not going to heal. So I was helping out in doing these things. Came back into my level 3 undergrad. And at the time, I wanted to tell the world of my experience at the time. So I did some talks to my other students in my course. I also then presented at national level at conferences, and also international level in podiatry conferences. And also I wrote some papers on that at the time as well, whilst in level 3. And then I moved on to level 4. So I had big interest in tissue viability. However, my interest in musculoskeletal and orthopedics, came back. And for my dissertation, I looked at the effects of peak pressures. Again, Ian talked about computerized insoles. I can measure peak forces in the foot. They had just acquired in that time something called a PEDA that can do that. So I used that for my dissertation. I got in touch with professional football clubs in Scotland. Some said no, some said yes. So I went over and collected all this data and did my dissertation. And in fact, that paper, I published that paper, which was effects of peak plantar foot pressures in the foot in professional footballers. And people do not know that was actually my undergrad dissertation, and that paper still gets quoted and sometimes talked about by some colleagues who teach. So I'm conscious of my time.
Derek, yeah. So to say, I'm very aware. I would like to ask some of you some other questions, if that's okay. Is that all right? So yep. Where you are based now is you are actually based within the university environment as an academia. So I think what we've shown here is we've got examples of Emma, who is obviously undertaking her studies, and he's on that journey. And hopefully, Emma, you've learned from 3 people there. There are big opportunities for you. And we've then learned with Ian and the route that he took, very much within the private practice sector. And then we've got Sol, who's very much driven via the leadership and it's NHS, and then obviously we've got Derek within the academia environment. Emma, I'd like to ask you a question. What is it like studying now? And I'm going to use this term, and please, I'm just not just as a mature student, because I think we all get this concept of university in our heads, that university is for young people, but we know it's not. So do you want to just say what it's like to be a student who's all from a career changer perspective?
Yeah, so on our course, I am not the oldest. And most people are of my age, to be fair. We've got two people who I'd say have come straight through the educational system, and everyone else is classed as a mature student. And it's good because also with this course, it's practical as well as theory based, and they both kind of run concurrently alongside each other. So if you're more of an academic person, then it tickles those fancies. If you're more of a practical person, it also tickles them and brings them both together quite nicely. So it's very appertaining for both aspects.
So from your perspective, you don't feel out of your depth. You're very much among a cohort of individuals who like you from that perspective. Was there any concerns and worries then before you went off that you were going into an environment that was going to be completely alien to you?
Yes, there was a slight concern that I was going to be like the oldest and everyone's going to be 19, 20. But I actually had a conversation with one of my colleagues who is she's 20. And I was like, how does it feel? Did you expect everyone to be young? Because it's kind of flipped on its head, if that makes sense. She's one of the youngest here, and she's not got many people on this course who are of the same age as her, but we all kind of gel along. I don't know if it's my background, because you work with all ages. When I was in the military, it doesn't matter how old you were, as long as you could do your job and you got on with each other, then you can apply those principles. And it's quite nice to have a mixed background and a mixed age group of people. It makes it interesting.
Okay, Ian, do you take students then as part of within your sector to support them educationally?
Yeah, we tend to have them on sort of work placements and things like that. So everything this year, we've had some 15-year-olds sort of looking at careers in healthcare. And last week I had a colleague who's been practicing for about 20 years here on a placement. So just shadowing sort of thing. So I mutually mentor a guy down in London because we run sort of parallel practices. So we sort of help each other out there. So there's lots of different routes that we do that. I will say on the academic side of things, I'm really quite severely dyslexic, have the reading speed of an 11-year-old. Handwriting that's very well suited for a medical profession, and there's loads of support for getting there. You don't have to get the top grade. No one's ever asked me really what grade I got at university. They just want to know if I can do the job. So don't let the academic side of it put you off if that's not been your strong point, because for a lot of us, I remember when I was in the army, that was why we were in there.
And I know we've got some individuals from the universities who are going to come in later. It might be worth, I don't know if you're able to put within the chat, how you would support individuals like Ian, because I know there is the reasonable adjustment policy within the NHS, which should support individuals like Ian, who is dyslexic. And I know from individuals I know who've gone into the university environment, universities are able to support from that. So again, that's another thing which is quite important. There is no reason why you can't do it at the end of the day. It's just more about how you navigate that. So from your perspective then, do you take students on placement with you in Sheffield? And where do you take them from, and what years, etc., etc.?
So we predominantly take university students, undergraduates, in their first, second and third years. And that often leads to a job for them afterwards, should they choose to work for us. And we usually have them for block placements, anything from 4 weeks up to 3 months. And we have them from all over the country, from Southampton all the way from Huddersfield. And some of those students actually stay in Sheffield for that period of 3 months while they're doing their placement. So they get to sort of culturally integrate with the staff and the local area, which is quite nice. We also take students from the local schools in their, I think it's year 15, so age 15, who are doing placements just as an interest, just for a couple of days, just to see. So, but we also do a lot of staff from other areas around the NHS who come to shadow, whether it be our specialist diabetic foot teams. We get a lot of people shadowing the research element. but also a lot for the MSK as well. So it really is very varied. And some of those people who come have been in practice for years and years. They just want a refresher to see how things are done. Others are just starting off on their journey and want to know what it's like to specialise in a different area. So they come and spend a bit of time with us as well. And just back to the point around what Ian said around dyslexia. So I joined the military initially because I failed academically at every facet of my young age. And when I was in the military, I was told not to mention that I had dyslexia because it would impact me in my progression. But when I went to university, they were very supportive and gave me strategies to combat my dyslexia, which then resulted in me going on to research and doing my own publications down the line, which I would have never thought possible when I was in the army. So what I would say is there's a lot of, if you're willing to embrace the support that's out there, then anything really is possible.
And Derek, then from your perspective, and you're very much in the academia environment, I think it shows, and we talk about this within the health environment, there's the 4 pillars, isn't there? There's the clinical side, there is the leadership side, there is the academia side, but there's also the research side. So whatever your flair is, there is an opportunity to follow that within whatever your career is. And I think the examples we've given. So would you say, from your point of view, it's about getting the mileage as being a podiatrist, but also be aware, and I think this is quite common nowadays, the 4 pillars is started from day one?
Absolutely, I totally agree. I think obviously, we do follow different pathways. The good thing about podiatry, when I looked into it, is that it does give you that opportunity to choose a path, whether it's a clinical path into a particular specialty, whether it's research and academia or even leadership, it does give you those opportunities. It does allow you as well to sometimes, move from one path to the other or take 2 different paths at the same time. So in terms of opportunities, it's a career that you can make what you want, really, in terms of work. It's every day is different, and I think people join the armed forces because of that. Every day is a challenge and every day is different. And podiatry, I would say that every day is a challenge and every day is different. If you're clinical, you do not know, what your patient is coming from, and you need to work out what the issues are and how to treatment. If you're doing research, it's the same. It's about learning, and if you're in academia, it's about teaching. So every day is different. Every day is a challenge. So yeah. Mm-hmm.
And I think from sort of the messages that I've heard from you is that every day is different, and I'll agree within healthcare every day is different, and particularly with the challenges we're facing at the moment. From where you saw yourself when you first started, and I'm going to each individual, to where you are now, what sort of challenges did you face on the way? And I know, Ian, you've talked about your dyslexia was a challenge, but what other challenges have you faced throughout your career, and what transferable skills do you think you brought from your armed forces career that helped you to meet those challenges? Do you want to start, Saul, first? So I throw you in the deep end on that one.
Yeah, certainly. So I think military personnel are extremely well placed for a lifestyle in healthcare, because they're extremely flexible and adaptable. And the healthcare landscape changes from one minute to the next, whether that be different clinical practice, different pressures on the population. So the military are very, very good at flexing and adapting to the situation in front of them. And if they bring that principle through into their sort of into a podiatry career, then that will bear them in good stead. And what I mean by that is just like no day is the same. We're going into winter pressures at the moment in the NHS. So things will change and shift to support the main acute hospitals. So my team will have to shift and adapt to make sure people don't go into hospital as much. So we flex and adapt in that way. So I think for me, that is one of their biggest strengths, that they can generally put their hand to anything, they can apply themselves, they can knuckle down, and they can get through it. So for me, I think they're very well placed for careers in healthcare. The biggest challenge that I faced when I left anything, going from the military to Civvy Street, was that transition from being in the military to being a civilian. As in the military, I have a certain standard. I expect X, Y, and Z. I expect others to do their best. I expect others to deliver. And actually, that's not what actually happens in general civilian life. So for me, the biggest transition was just to observe and reintegrate back into that civilian life from the military. I have a brother who's done 30 odd years in the military, and he cannot reintegrate back into civilian life. He is struggling. So what I would just say is, for anyone who's particularly going into university, it is a different world. Just be mindful of where you've come and where you're going. And I think that was my biggest challenge.
And it's quite interesting what you've just said there. So that comes out quite a bit in some of the other insight days we've done, is where people from an armed forces background moving into the university environment. And Emma, have you noticed that you've moved from one area into another area, and it's a bit of this is interesting?
Yes, it is. So like you've got, like you were saying before, there's expectations in the military and standards that you have to keep, and you hold yourself to, and then you come into civilian life and university life, and it is a shock, but you can still hold yourself to them standards if you so wish. If you want them not to be held so high and have an easier way, you can also do that. But obviously, like the time management and deadline management and all of that stuff can be brought over from the military life. And then your life is so much easier because you've already got those instilled within you, and you just let other people crack on how they are. Sometimes you have to soften your skills a bit, socializing and whatnot, but that's absolutely fine as well. And it makes the world that we're in today.
Ian, from your perspective, and I think that the thing is, we must be aware we do have standards within healthcare, and those, but they're sometimes they're slightly different standards and the way in which people portray them. But I understand where you're coming from. The military certainly has standards, and sometimes moving to different standards can be a bit of a challenge. Ian, what about you from your perspective? Because I'm sure you've seen that in the variety of environments that you've worked.
I think I could reiterate all the things that have been said already, but I'd probably say to take two concrete things which the Army has sort of instilled or given. One of them is the ability to create an ethos. So certainly within my own practice and for my staff, we use probably military principles to a degree in terms of setting an ethos. And we have a service test essentially, which is every decision is for the patient's benefit. And as long as my staff use that as the baseline of their decision making, they will get backed by management and the support structures. The other side of it is the ability to have sort of a formulated planning process. So obviously there is as an NCO or an officer, you'll have gone through various different planning processes. And when running a business, you've got to be the clinician, you've got to do the marketing, you've got to manage the building, you've got to manage the contracts and solicitors and things you've got to work with. You've got to provide education both for yourself to make sure you're up to date and your staff. So the ability to lay that out in a planning process and make sure you're filling in all the different bits on the way, the in order tos, and that kind of stuff. So 1 up, 2 up intent, knowing those kind of things. It's obviously you might use a different language, but those skills are definitely coming into, I'm sure Saul's used them in the management area as well, but I've certainly used them in the business planning process, which you've got to sink or swim. It's your baby.
Yeah. Well, it is when it's a business, yes, but I think the same applies within the NHS. We're there for our patients, and I think that ultimately is coming across from what we're hearing about today. The work that Derek's done around the research, etc., that is patient for the patient at the end of the day. Ian, you serve a patient population and you're able to provide that through your business. So you obviously provide that within the NHS. We're there for patients, and I'm sure the throughput and the volume can be overwhelming at times. How do we manage that then as clinicians when we're being put under so much pressure? What skills have you brought from your world of the armed forces? And I'll go to Derek first on that one.
Okay, so coming from an academic sort of background, and I think I'll talk about the academic. You're coming into education, and it is a big change, in terms of learning. You're coming into this environment now. One of the good things about being in the military is you bring life skills, and you bring determination, and you bring skills that will help you definitely navigate your way, your way through the. Obviously, you need to be organized. Your organizational skills in terms of, you have to give yourself targets in terms of reading, in terms of learning, in terms of meeting targets for assignments, in terms of preparing for exams. So I would say from an academic perspective, you're bringing in a lot of skills that will really help you navigate your way through the education system.
Okay. So again, there is that transferability. So the same for you then. The NHS is under a tremendous amount of pressure, and I know podiatry services within the NHS are under extreme pressure and the challenges.
It is, and it's more than ever now. We invest in our principal asset, which is our podiatrists, our staff. So we invest heavily in them, both from a well-being point of view, around making sure that they have got doable jobs, they're not overwhelmed. Also about their future and their training. So we make sure they've all got well-defined training plans, and they're on a career that suits them and they're happy with. Because one thing we have learned, that if we don't listen to what the staff want, then they'll quickly move on. So we invest heavily in the individual staff, whatever it is that they want, and within our gift, then we will support. It's also around about trust as well. By the time they graduate, they are autonomous diagnostic clinicians. They know their stuff. We put checks and balances in place around training, governance, and audit, but it relies heavily on trust and autonomy within boundaries. And we often find that the more autonomy our podiatrists have to go away and do service evaluation, they see a gap in patient care and they say, we can do better. I want to go and do X, Y, and Z. And we let them run with it. We give them that responsibility. We often find that really increases job satisfaction. I've just got a podiatrist now who saw a gap in an area that we could do better. We've let him run with it. We've now got these specialist clinics around F-scan, a pressure measurement system, and he's now running that clinic. And that we didn't have that before. He saw that gap and wanted to run with it. So we just try and invest heavily in the individual, give them as much autonomy as we can, and we build it around that culture of trust and mutual support. And ultimately, we just try and we've got 60 odd in our team, and we just try and be that one big team across the whole organisation. So we're very small. There's 19,000 staff nearly in our organisation. So they make a very small part of it. So we just try and make sure that they've got that culture of support, trust, and that seems to be where our strength lies in such a small profession.
And Ian, sort of off of that then, so I suppose one of the challenges of running a business is obviously the business needs to create income, but also we need to make sure that the people who are providing the care, the podiatrists, are kept up to date. So what sort of support and mechanisms are in place within your environment to ensure that you've got highly skilled clinicians delivering the care that your business requires?
Again, I think it's going back to the ethos word. It's patient driven, not profits driven. So you're not going to be a millionaire by being a podiatrist. I think I only know one millionaire podiatrist, and he did it by owning property, not by being a podiatrist. But it's by being patient driven. We've got perhaps longer appointment times than you'd have available in the NHS. So the staff can build the type of relationship with that patient that they get a good therapeutic outcome. I've certainly done counselling courses and various things like that, so I know how to ask the right questions to understand why the patient is here and why they might not have sought other routes, working with other health professionals, referring into disciplinary referrals, things like that. They're all very good. I think we do mainly conference-based education pathways, so people get to, if they want to have a specialism or more an interest in something, then we would send them on either a training course or to a conference that's relating to that. I think I probably go to between speaking at and attending about 6 or 7 conferences a year as a private practitioner. So that's traveling around the country, staying in hotels and either attending or lecturing at conferences. And that all counts as your continuing professional development, keeping yourself up to date. There's nothing like having to deliver a lecture on something to make sure that you're spot on with where it needs to be.
Okay, that's really helpful. Emma, so did you say you're a second year student? Is that correct?
Yes, I am indeed.
I want to know about your placements then. So what have you had the opportunity to experience so far? So during your studies, you will be learning as much as possible about the world of podiatry, but as they say, you probably don't start to learn until you're qualified. And I don't know if my other colleagues on the call would agree with me with that. So what have you done so far? What have you undertaken during your studies?
So this year so far, second year, we started with a 4-week placement in the NHS. So I was at the local trust here, and it's county-wide, the trust. So we did everything from wound care clinics to MSK surgery, and we basically shadowed to begin with the practitioner, and then we had our own clinics under the watchful eye of the podiatrist, where we did the general care as well. So we got a wide variety. Last year was slightly different. In our first year, we had Leaf Hospital. So we were, every week we were in there for a day and a half, seeing patients who were coming in. So you get both sort of sides of it, depending on which university that you choose to go to, depends on what they have access to. But moving forward, I've got another NHS one coming up for 4 weeks. And then next year, we've got the diverse one is in next year, not next academic year. And then you can go into the leadership side if you want to, educational side. And then that's hitting all those pillars. You can also go into, private practices as well and see how that they run and whatnot. So you get a really wide variety. So you're not just channeled down into one sort of aspect of it. You get a right breadth of knowledge and experience from everyone.
And what's your plan once you qualify then? Where do you see yourself to start with? I'm not going to say in like 5 years or 10 years. I don't like that question because none of us really know. So where would you like, when you qualify, what is your plan when you qualify?
So ideally, if all my stars align, I pass, and then I would like to get half NHS experience and half private, and be exposed to both, depending on what jobs are available out there. And because I think the NHS offers you a lot of CPD and experience and fast pace, and almost sort of like the military side of it. There's the structure as well, and you can work towards stuff. And then the private stuff, if you get different types of clientele that come in and different pathologies and all of that sort of stuff. So hopefully if I can do side by side, even if it's 1 day a week private, 5 days a week NHS, or half and half, see what's available at the time.
Okay, that's great. And I think from my perspective as, say, physio, I've worked alongside podiatrists in the NHS for a number of years, and it's that collaborative working which I think also is important sometimes. And as I said at the very beginning, if you liken the AHPs, we work together at times. There's a lot of collaboration, a lot of working, and I'm sure even within the private sector with Ian, you collaborate with other AHPs, other healthcare professionals from that perspective. We've got about 4 or 5 minutes left. So what I'd like to do now is, this is the question to all of you. What is the one thing that surprised you about podiatry when you came into it, or now? What is the one thing that's really surprised you about podiatry? Let's start off with Derek. So what is the one thing that surprised you about podiatry?
I think it was the diversity of opportunities, available. And it wasn't until I qualified as an undergrad student, with my degree, BSc degree, that I just realized, that there were so many different directions I could take, from, as I say, I chose a particular direction, but, I was thinking at one point of tissue viability, going into diabetes, obviously you need to start at the beginning, you start as a podiatrist, and then you can look at specializing. But yes, during that sort of interim period, it was just so many things, it was a little bit initially, I wasn't sure, which direction to take, at that point in time, and hence, spending a few years, working as a podiatrist and getting some experience as a podiatrist, or we could say a general podiatrist, is very important, because that will help you then decide which direction you want to go. But yes, I would say it was more really, the opportunities that you have is just amazing.
Okay. Ian, what about you? What's the one thing that surprised you about podiatry?
Well, Derek's nicked it, so I'm going to. So the diversity of opportunities is the surprising thing. No one's ever heard of podiatry before, and then when you scratch the surface, it's got everything in it. I'd probably say, if I was to go for the next most surprising thing, is the ability to create diverse networks of people that you're working with, colleagues from different professions, learning from each other, growing your practice, growing your knowledge, and growing your confidence within that sort of supportive and competitive world. So, again, I think those military skills of, working your way up the chain of command, so to speak, but in terms of putting time in and growing things, but that ability to network, still have camaraderie and build those connections.
And you, Sol, what's the one thing that surprised you?
Yeah, it's getting hard now, thanks to Derek. He stole the main one. So I think for me, podiatry is very much a gatekeeper profession, very much in the NHS, and you don't realise until you become a podiatrist how integral you are to other healthcare professions. So, for example, now I do a lot of work with the nursing teams around tissue viability, vascular, and the community nursing. Now, I wouldn't have thought a podiatrist would have any place in that world, but you actually sit very high in their world, and you help guide their clinical practice and their treatment. The same is with the medics who are the diabetologists and endocrinologists. We are at the seat at the table with them as a partner. We're not subservient. So you sit there, and they really, really value your input, your skills, your knowledge, and they often come to you for that. The same is with physios and orthopedics in the foot and ankle pathways. You sit at the table with them and discuss it. You're not subservient. So I think for me, what was so surprising is the fact that when you become a podiatrist, you get those skills, you are invited to sit at the table and be very broad around the strategic direction of clinical care for the population. And I think that's there's not many professions that get a seat at the table so broadly in so many different areas. Whereas I can be with nursing in the morning, orthopedics in the afternoon, vascular in the afternoon again. So I think for me, that opportunity for you to really get out there and explore the healthcare landscape and world and be involved as much as you want to be is quite a precious thing that very few professions get.
And what you just said there, sorry, go on. Yeah, go on.
Point a little bit. I've had many practitioners in as patients who are GPs and other types of professionals. And when it's kind of a bit of an undervalued profession, I think feet aren't sexy. And obviously feet are not all we do. They're at the end of what we do. But when clinicians actually start to understand what you do, what the scope is, the amount of times people had doctors say, you've got a lovely little niche here. And, they're envious of the ability to form those relationships with their patients, see them through to actual genuine outcomes, life-changing outcomes for those patients, back doing the things that they love doing. So, all the injuries that people have mentioned that stopped them in the army, and I was lucky not to get that kind of thing. But, I can't think of how many people dropped out of my P company because of knee pain. And I could probably have helped about 90% of them get to the end of that P company if they'd have had the type of intervention that I do now. And other professions aren't as aware of it as we'd like them to be. So Saul's seat at the table is really helping us change that as well.
And finally, Emma, because you're on that journey, what's the one thing that surprised you about podiatry, but more importantly, about having to study podiatry?
There's something for everyone. In the fact that if you think, you're just going in to do feet, you learn about so much more and how everything connects and how you do need to use your skills of talking to people, active and listening and all of that sort of stuff, and everything that you're taught from the military side. And I never realised how transferable all those skills are. You think you do a 4-week or a 6-week leadership course, like later on in life, that pays dividends, and you can bring all of that to the table of podiatry, and there is literally something for everyone.
Brilliant.
I just jump on that a second.
Yeah, go on.
The organisation I work before actually sends their NHS leaders to the military for their leadership training. So you've got an abundance to offer, because it's working the other way as well, you know.
Definitely. Right. Well, hopefully those listening have found out that it is possible to move from an armed forces career into the world of podiatry. And what we've got in front of us is a wealth of experience and knowledge that's been developed over those years. We've got Emma, who is just on that career journey, but is bringing so much from her former armed forces career. We've got Derek, who's up in Scotland, exploring and expanding the academic world of podiatry, which is so important. We've got Ian and the way in which he's taken his business forward and showing that from an armed forces career you can develop from that point of view. And then we've got Sol here, who is driving forward podiatry services within the NHS. I'd like to say a big thank you to all of you. I know some of you are busy and have got to go off and do other things and, you know, earn the monies, etc., study, whatever it be. But again, thank you very much for your time. We do appreciate it, and take care. Thank you. Right. Okay. So what we've learned there is this morning is we've learned about podiatry. We've learned about how you can become a podiatrist. I'm going to learn a little bit more about that later on. We've also we just learned about those individuals who've taken that step from an armed forces career to that of the world of podiatry. We're going to have a quick break now, a quick comfort break for some people, get a drink, etc. And when we come back, we are then going to watch some films of colleagues who from Guy's and St Thomas's. We're going to watch podiatrists at work, and what we're going to do is you will be watching, and the narration is going to be live by those podiatrists who actually you're watching. So if you'd like to come back at 11:32, that will be great, and we'll see you then. Thank you very much. Okay, welcome back. Thank you for joining us for the second part of our Insight Day on the career of podiatry. We learned this morning, first thing, about the profession. We've learned about routes into the profession, and also we've learned and we've listened from those individuals that have moved from an armed forces career into that of the world of podiatry. And the diversity what we heard about was amazing, basically, from 4 colleagues from various sectors. Right, what we're going to do now, so if you have the next slide, please, is just before we start, I'm going to introduce some colleagues from Guy's and St Thomas's Hospital to you. I would just let you know I've posted into the chat some links, and one of those links is to the website called Health Careers, and that is the NHS England's health career website, and that talks about not just podiatry, but it talks about other careers within the health NHS. And as I said earlier, there's 350 of those careers for you. But I've also posted within that an actual link to the website, our website that we have, and there's a number of case studies on there, individuals not just who've moved from armed forces to podiatry, but armed forces into other AHP careers as well. So what we're going to do now is we are going to move on to the next stage, which is we are going to showcase some podiatrists at work. And I've been fortunate enough to work with colleagues from Guy's and St Thomas's Hospital, and what they've gone and done is they have videoed podiatrists in action. So if we could bring down the slides deck, and I'm going to hand over to Gareth Stockley and team. And what we've gone and done is we've brought in some colleagues who have actually done the videoing for us, and they're going to narrate. Now, I'm not sure which order we're going in, so I'm going to leave it very much hopefully we can get the order right. So
that's
I don't
fine.
know who wants.
I'll introduce myself. I'm Aidan. I'm the first video today, so thanks for inviting me along today. I'm one of the MSK podiatrists here at Guy's and St Thomas's Hospital. So what I'm going to do is sort of narrate you through a sort of MSK assessment that we would do on a sort of a normal day in our clinic. If anyone's got any questions, if they could, I guess, pop them in the chat, and I'm more than happy to respond after I've finished talking through. And I think we'll be then going on to my colleagues, Nick and Tajal, who will talk you through some other days in the lives of the podiatry profession. So do you want to, Gareth, are you in control of the play button? Yep. Okay, so can everyone hear me okay? Yep. Okay, so what we're doing here is patient who we have here today who's come in complaining of pain in both feet and the heels. So what we are initially doing here is talking to the patient about her symptoms, getting a feel for the symptoms. As you can see, we're examining the patient's feet to try to establish where the symptoms are, what triggers the symptoms. As you can see, the patient's describing the symptoms she's getting to me as we're effectively palpating around the foot, trying to establish whether the symptoms are in the bone of the foot, the soft tissues, etc. We're also now having very importantly at how a patient walks to try and assess what their gait pattern or walking style looks like. We've got the options of assessing them, as you can see in the clinical area. We also have treadmills that we can use if we want to see the patients running. As you can see in this case, the patient has very flat feet in addition to some bunions. What we're now doing is looking at the function of the foot to see what the muscle strength is like, what the foot does when it fully operates. As you can see, just from looking at these feet, they are quite flat. So what we suspect is that the flat feet are contributing to the patient's symptoms by putting unwanted mechanical stress and strain on the feet, leading to stress of the tissues there, or what we would term sort of biomechanical misalignment. So our treatment plan, as you will see in a moment, is to try and address these biomechanical features through things like insoles, which I know the video will move on to in a moment. What we're doing here is loading up the feet to really appreciate what happens under load. What we've got here is the patient standing on what we call a foam impression box to allow us to match an insole to the foot type a little bit more accurately, and also in this instance to show the patient what her feet actually look like under load. It's very hard to look at your feet and appreciate what sort of foot type you've got, so we find that this really does help the patient appreciate how flat their feet are and why it could be a problem in this case. As you can see now, we're fitting up the patient with some insoles to try and address the flat foot and consequently improve the alignment and the posture in the foot, and then to try and in turn reduce the unwanted mechanical stress and strain that's occurring on the foot and contributing to what we suspect is causing her symptoms. So we've got the patient now in the insoles to make sure that she finds them comfortable. Obviously, there's no audio on this, but the patient did actually notice an improvement walking with the insoles. She felt more aligned overall. She's doing her shoelaces up at the moment, obviously. We'll see her walking in a moment. It's just generally better having had the insoles on. While she's walking, we're explaining to her the importance of obviously wearing good shoes alongside the insoles. Very difficult, I know, to sort of appreciate the foot inside the shoe, but the patient did feel more aligned and more supported. What we would then do is get the patient with the insoles for the next 8 to 12 weeks or so. Whoop, there we go, done. Sorry, next one. Any questions in the chat for me? Thanks.
Okay, that's okay. Thank you very much. So let's do the next video. I think it's Nicholas. Is
yeah,
right, Nick?
I'm up next. Yeah.
You'll go on then, Nick. Off you go.
Okay. So we get the video up. Yeah, hi everyone. My name's Nick. I'm a podiatrist working for Guy's and St Thomas's at our community sites, and I specialise in nail surgery. So we've hopefully got a video coming up for you. There we go. Yeah, so we undertake around about 20 nail surgery procedures every week, mainly for painful ingrown toenails on patients of all ages, really. And this procedure it's a type of minor surgery. It takes around about 1 hour to complete from the moment the patient arrives to when they leave. And here I'm just marking up the surgery site on the patient's toes. And today I'm going to do nail surgery on both of their big toenails. And that's because they've been causing her pain at the sides. And so there are 4 sides of toenail that I'm going to remove. And I'm just making sure that she understands the procedure. And off camera, we've gone through quite a few safety checks up to this point. And she's signed a consent form as well. Now we've got to the point where I need to numb her toes. So I do this with local anaesthetic. And this is really similar to the stuff that you might have had at the dentist. And there are 2 nerves that we have to knock out on each side of the toe. So there's one near the top, near the surface where the needle goes in, and there's one much deeper down at the bottom of the toe. But both of those injections can be, both of those nerves can be knocked out with 1 injection. So just doing the same thing on the other side. And we most commonly remove the side of the nail for ingrown toenails, but we can also remove the whole nail if that's causing painful problems. And this procedure is something that is covered in the undergraduate course. So you would be qualified to undertake nail surgery such as this after graduating with your degree in podiatry. There we go. And I've skipped forward a little bit here. Both toes have now had the injections, and we have to wait around about 5 minutes for the anaesthetic to take full effect. So here my colleague Ramesh is just testing around the toes with a pin, just to make sure that the patient can't feel anything painful. And once we're happy with that, we start preparing for the nail surgery. So the feet get painted up with some antiseptic. And in the meantime, I've washed my hands with some surgical scrub, got some sterile gloves on and all my PPEs. So that's the usual aprons, and we have a mask and a visor as well. And I do that before I set up all the kit here. So everything in this white pack here is all sterile. So at this stage, I'm the only person who can handle all of that because I've got my sterile gloves on. So my assistant there, Ramya, is just going to be handing things over for me because I can't touch the packets. Okay, so once we're all set up, the first thing to do is to apply a tourniquet to the toe. So a tourniquet is just a really tight rubber band, and we push that over the toe. And what that does, that cuts off the blood supply during the procedure, and that prevents bleeding, and that allows me to see what I'm doing during the procedure. But it also, once the section of nail is removed, we put a chemical on there, and it allows the chemical to work without it being flushed away or diluted. And once these tourniquets are on, we have to keep a really close eye on the time so that we don't leave them on for too long. So we don't like to leave them on for more than 20 minutes, and that just prevents any sort of long-term damage there. So I've made a start now, and I'm elevating the toenail. So that's just means I'm separating the nail from the side, from the skin at the sides, from the nail bed underneath. And I'm using a really fine instrument here just to push down. The reason I use a little instrument is just so I don't disturb the main part of the nail bed. So I don't want to disturb that. I want to leave that all nice and intact. The only difference from that would be when we're obviously removing the whole toenail. We do the same thing just across the whole nail. Once that's done, we use a special pair of nail cutters. They're designed to go vertically down the nail, and that creates a new nail edge. We're just cutting that there now. And then I'll switch over to just a really fine mini scalpel, and I then extend that cut down under the skin, so we don't have to cut through the skin at all. Go down underneath and then through into the root and through the root of the nail. We call that the nail matrix. And once that's all done, that piece of nail is ready to come out now. So we just grab onto it with some forceps, and then it gets gently eased out. There we go. So that piece of nail out. Now I'll just move back to my vertical cutters. They're called thwaites, and we do exactly the same on the other side there. So we just take our time to line everything up, because each toenail grows slightly different direction. They have their own natural pattern. We try to respect that, just so it gives a more natural look at the end. So this procedure is called a partial toenail avulsion. So we're just removing the size of the toenail. And the next thing after this will be to put that chemical on. And that's called phenol. That prevents the section of nail removed from growing back, causing the same problem. So once again, just grabbing onto that piece of nail, which is now all separated, and just easing that out. Go. So I mean, patients often expect there to be a lot of pulling or tugging when we remove toenails, but this really isn't the case. I mean, so as long as the preparation's been done correctly, the nail should come away really easily. So it's much better to be gentle and slow, as the nail's often really fragile, especially at the root. And if it breaks off down there at the root, could leave some of it behind, and then it's going to regrow and the surgery would fail. So we don't want that. So again, just making a start on the other side by separating that nail there. And then I'll do the same as I've done on the other ones, which is using the cutters and the scalpels. And I would just skip forward a little bit here. So so all 4 sections of nail are removed, and I'm now applying that chemical. That's the phenol. So phenols are just a really strong acid. It's called carbolic acid, and it destroys the root of the nail. And what we do is we apply this for 1 minute, and then we repeat that 3 times, just to make sure it's definitely had effect. That just means those 4 bits of nail that I've taken out, they can't possibly grow back now. Okay, so we've just pushed forward a little bit, and that's the last application of phenol. So we've done the 3 minutes, just taking off last remnants of the phenol, and that's the surgery complete. So the only thing we've got to do now is get those tourniquets off. The easiest way to do that is just cut them away. And then we record the times that those tourniquets have been on. That all gets put into the notes. The notes for nail surgery are quite extensive, recording lots of different things. And then as soon as the tourniquets are off, the blood can return to the toe. So it usually starts bleeding fairly quickly. You can see a bit of blood there. And then it takes a couple of minutes or so just to apply a bit of pressure to get that bleeding to calm down. Then we can start applying the dressings. There's quite a few layers that go on. The dressings are quite chunky straight after the surgery. But the patient can walk afterwards. So we like them to go straight home, lie down for a few hours, take some paracetamol if they need it. It's not usually a lot of pain after this type of surgery. And they usually then come back to see us 2 to 3 days later for a checkup and a change of dressing. And we make the dressings much smaller at that stage. So usually they can then just resume normal activities after that redressing appointment. And we normally discharge them and then they look after the toe themselves until it's fully healed. And that takes around about a month. So there we go. I mean, I find nail surgery one of the most satisfying things you can do as a podiatrist, especially if you're quite dexterous with fine motor skills. I regularly see patients who are in quite a lot of pain, really apprehensive about the procedure. I mean, within an hour, you fix their problem, hopefully, and I find that incredibly rewarding. So just putting the last bits of the dressings on. And yeah, I hope that's been interesting to see some of the type of work you can do as a podiatrist. Thank you very much for watching.
Thank you. No, that was really interesting. No, very, very interesting. Yeah, and I'm sure it's an essential part of ensuring that people are able to maintain mobility in a way in which gives them a lease of life, which is important. Right, final video. So over to Gareth and final colleague. So do you want to go?
Hi, my name's Tejal. I'm one of the podiatrists working in the hospital settings. So I specialize in wound care. So I'm going to show you 3 videos of a dressing that a treatment plan that we would do. This first one here is, you can start that, Gareth, is called total negative pressure, and it's using a pressurized dressing to suck up all the discharge using this special sponge and the canister, which you'll see at the end. It kind of speeds up wound healing. So this is one of the very common ones that we tend to use in wound care. For surgical sites, or in this case, a surgically debrided site which had got infected. And we normally have it at a pressure of 120, which is the common one for an optimal wound healing bed. That's usually applied for about 4 or 5 days, and then it's changed, sometimes up to 7 days. The canister is then changed as well. The second one, Gareth, is a casting technique that we tend to do. Now, this one is for somebody who may have an ulcer on the bottom of the foot, or it may be an offloading device for a Charcot foot, which is one of the complications of diabetes. You can see that they're protecting all the prominent sides so that the cast doesn't rub, and the whole leg is then wrapped with soft band. And a special casting tape, not plaster of Paris, but a lightweight casting tape is then applied, just like as if you've broken your leg. And that stabilizes the foot and the leg in a certain position, and that tends to offload and speeds up healing. This is also one of our very common treatment plans, and obviously it is time consuming, but you can see that this patient has got a little bit of a bowed leg, which is very common. The third one, and finally, Gareth, sorry, is our larvae treatment. Now, this is a blue bottle green bottle fly larvae. Sorry, not this, but it's going to start in a minute. That is cultured in a sterile field. It is a biobag, which means that it's sealed in a bag and applied. And it's really great for eating up all that fluffy wound. It cleans it up very quickly. And then once you've got healthy red granulating tissue, it tends to heal up really well. We just put a little bit of pseudocreme around it just to protect the surrounding skin, because the larvae does produce a lot of discharge, and that just protects it. Patient just leaves it alone. If they're leaving it on for about 5 days, we do tell them to make sure that they just moisturize that gauze a little bit, just so that the larvae are hydrated. But it's really, really good for cleaning wounds. It reduces the use for antibiotics. Yeah, that's it. Sorry, that was really quick.
That was amazing. Absolutely, all three amazing. And I think that shows the diversity that podiatry has. You know, it's the lower limb, and I think that's what we were showing there. It is the lower limb. You know, from the work that Adrian showed, the biomechanical side of it, or the MSK that we've heard today, the term musculoskeletal, that's what that stands for. You know, to the work that Nicholas showed, that is definitely important work, because, and it shows you the importance of feet are to us. And then your work there, Tetra, that I was blown away by that. I didn't realize that. I've obviously seen many a wound, but the advances within podiatry now are totally amazing. And I think I'm sure for all of you, it's great to be at the forefront of what's going on.
Yeah.
Would you agree?
Absolutely. And I mean, in my case, because I'm based at the hospital, we do a lot of work like with the other professionals, like the vascular surgeons, the plastics, the diabetes, the physiotherapists, and it's joint working, holistic approach to that patient care. And we're always learning new things. There's new techniques that's coming out, and it's just so interesting. It's absolutely fantastic.
And it's interesting what you said, Adrian. As soon as you'd managed and you'd altered the foot and you'd done your foot, that patient fed back, I feel much better. And I'm sure that must be so rewarding to know you've made such an instant input.
It is. It makes it is rewarding, and it's great for the patient, because a lot of people can't do what they want to do, whether it be in life or work or whatever, if they've got sore feet or sore ankles. So to sort of help as much as we can, it's great, really. Certainly in the current climate.
Yeah, particularly. Yeah. And I suppose again, Nicholas, from your perspective, if somebody is reliant on being able to work, we are making a difference to them being able to maintain, support the economy, etc., from that perspective.
Yeah, absolutely. I mean, often we see patients who, they've been off work for a while, or they've been off school. They're in a lot of pain, and like I said on the video, just being able to turn that around and sort that, particularly with the nail surgery, and fix that within an hour. Very, very rewarding. So yeah, I mean, I've come into podiatry from a different profession. I've been doing it 15 years now, but I've never looked back. I absolutely love the work that we do, and there's such a large scope of practice that we're able to do. It surprises a lot of people when they find out about podiatry. It's not just obviously cutting toenails, but quite a lot of people think that it is kind of just that, and it's far, far more than that.
No, it's definitely it's lower limb support, basically what we're looking at, and you work very close. And it was interesting because in some of the videos you were working with colleagues, you had colleagues supporting you, so it becomes a team. It becomes a team to move it forward. So brilliant. I'd like to thank you particularly for the time and effort that you've put in to create those videos. We're overwhelmed by it, and I'd like to thank you for your support today. So I'm going to let you go back, because I think you've got the day jobs to go back to now, which I know you obviously do enjoy. But thank you very much for your time. We do appreciate it. Okay.
Thanks for having us. Thank you. Bye-bye.
Bye.
Right. So what we've seen there is we've seen podiatrists at work. What we're going to do now is, and I think you've heard this morning, you've heard us talk about podiatric surgery. Well, we're very fortunate in that we've got a colleague, Susie Taylor, from who's a consultant podiatric surgeon, and she's from the Royal College of Podiatry, and she's going to talk to us about the role of a podiatric surgeon. So, Susie, hopefully you're on the call.
Yes, I'm here.
Yeah. Okay. So I'm going to hand over. I think you've got some slides. So we're going to let Martin do his next slide, please. All right. So over to you, Susie, and thank you very much.
Oh, thank you, Paul. Well, I mean, a lot of what I was going to say, those three fantastic colleagues have covered quite a bit of it, but I think you'll all find this quite interesting. Podiatric surgery, what is that? Well, I'm a podiatrist, exactly the same as my colleagues. Although during my career, I've layered my training and I've done a little bit more and a little bit more and a little bit more in different layers in depth into actually correcting foot and ankle problems. I'm going to talk to you just a little bit about that for a few minutes. I know we've got a question and answer session later as well, and you might have some questions for me. So the definition is up there on the screen, but really what I do is deal with people all day, and I say people, I mean people's problems all day, where they've tried everything non-surgical and they've got to the stage whereby nothing is fixing their foot problem, and usually that's a combination of 3 or 4 different things. It's not normally just one thing, it's a lot of things. So people come to see me. I work part-time in the NHS, part-time privately. And I do a day a week at the moment helping out at the Royal College in an advisory function as well. My role involves pretty much operating on anything that might be awry. I operate on bones, joints, soft tissues, and I do a lot of soft tissue work that needs some very fine-tuning, delicate work, such as removing tumours, mainly benign tumours, not cancerous tumours, but everything that comes out the body, out the foot and ankle, goes off to the lab. And very occasionally you do come across something that you really wish you hadn't. And this is why it's so important as podiatrists for us to work in the multidisciplinary team. We don't work on our own at all whatsoever. I wouldn't be able to do my job in that way. And so I'm going to tell you a little bit about what I do. So it's about keeping people active and at work, but it's also about keeping people socially interacting and able to go out, able to go shopping, able to see their friends, and able to walk around with shoes that fit. It's very hard if you have that foot on the left and you can see the big bump there on the side of the foot where the bone is sticking out a little bit. It's very hard to get that foot in a normal pair of shoes. Very, very hard. And quite often people have to have shoes made for them. So I really describe my work as a bit of a detective. When people come in, my first thing to do is to try and find out what's causing this problem. So I have a great array of knowledge and skills available that I use, that I've learned over the years that most podiatrists use. So my patient might need to have blood tests, they might need some sort of imaging or scan undertaken, they might need a local anaesthetic injected into a joint to see if we can knock off the pain for an hour and see where else hurts, what is the actual cause of this pain. I take a lot of biopsies from either from bone or skin or soft tissue and use something called a Doppler to undertake a vascular assessment and do some really in-depth work around nerve conduction studies, and if there's a nerve that's not firing, which nerve is not firing and what's causing the actual problem. So we can go to slide 2. On graduating, you will start doing the nail surgery that my colleague there's explained to you and we've watched, which was a beautiful example of that, because podiatrists have access to local anaesthetic knowledge and skills, and you'll use that a lot as a podiatrist. I use it a lot as a podiatrist, and I have done since I first qualified, on an everyday basis. And that can be from removing, I might see a young child and be removing the needles of a skin urchin out of their foot after their holiday with their family abroad 1 minute, and dealing with a teenager who's got a very infected ingrown toenail the next minute, and somebody who has a very arthritic joint or a large hammer toe deformity where their toes are deformed in some way and not sitting where they should be. Can be anything. See children from birth up to my eldest patient was 103, and every patient that comes to the door is quite different. So that detective work and a really sunny disposition is what you need, I would say. I think probably one of the most important things is to actually be in a situation whereby you can adapt the skills that you've got. So the suturing skills, for example, that podiatrists have, you can adapt them to the different things that you need to do. If you need to put a stitch in if somebody's lacerated their foot because they've fallen off their bike, etc., you can really deal with any minor emergency that tends to come through the door. I myself have had such a varied career as a podiatric surgeon or podiatrist who practices surgery. I've worked in Belmarsh and Maidstone prisons. I now work a day a week in Harley Street. There's so many things that you can do, and that's what we love about the skills spiral that is podiatry. You can start off as a generalist and then enhance your practice with a special interest, and sometimes you don't really know what that special interest is until you're actually working in the job, and then work your way up to consultant level, which is where I am. There are 105 podiatric surgeons in the UK. I've got a slide later, which I'll show you in a little while, which explains the training process, which is quite straightforward. Teddy, I'll put in the chat just in that she's done the prescribing qualification. Any podiatrist, once you've qualified, you can go and do the prescribing qualification. That's fantastic. I use my prescribing every day for my patients. I write prescriptions, and again, it's quite a very useful tool to have. That means that people don't necessarily have to go to the GPs just to have an appointment for a prescription. When they're with you, you can do everything curative to that patient other than surgery. So then the patients would then come to me, and I would then talk to them about the different conservative and surgical options and go through all the risks and benefits of each type of option. And then the patient and their family, who will be providing that home support, they come to a decision on what they want to do to go ahead. The actual profession, as Paul just described, is medicine itself, particularly podiatric medicine, is developing all the time. I've just been on a course literally 4 weeks ago to undertake my second stage minimally invasive surgery. There's a lot of robotic surgery that's going on now, and there's really is quite a lot of innovation and research that's happening, because everything we do is evidence-based, and that makes the job beautiful in terms of being structured. Could we go to oh no, this is fine, we can stay here. So basically, what is it about my job that I like that's a structure? And it really is very regimented, it's very defined, and that's lovely, because for me as a clinician, it takes the stress off of it. I know that when my patient comes in, the first thing we're going to do is confirm the consent, then we're going to mark the leg that we're going to operate on, then we're going to mark the toe, then we're going to define the patient's allergies, medications, etc. Then when the patient comes to theatre, there's not just me there is a whole team of people. I work with at least 3 support workers, and we work together, and because it is so structured, every instrument that you're going to use is ready for you. Every order in which you're going to use those is there. And that's really a lovely way to work, because it allows you to have a process that eliminates as much of the risk as humanly possible. And that's really nice. And when things go wrong, which is very, very, very rare, but can happen, you can see where your process didn't follow and how that happened and how that went wrong, which is a really nice way to be. I train a lot of other people. So if we go to slide 3, and that being a teacher,
Susie,
yeah,
I'm going to need to move you along if you don't mind. Is that okay?
Yeah, sure.
Thank you.
If you go to slide 3, we've got there the map in England of all the training centres, and you can train you can either self-fund your training, or there's an apprenticeship programme for your training. And that, sorry, I put the old slide in by mistake. That should say we have an annual conference with a surgical track, and this year it's November and it's in Harrogate, and everyone is welcome. And then my last slide, if we can go to the 4th slide, is the training career pathway for podiatric surgery. It's quite small. If you'd like to know more about it, this is on the Royal College of Podiatry website. So it's on here, and I'm very happy for people to email in with any questions they've got, and maybe arrange a placement for people if that's what you would like. If you find that having a placement with a podiatrist to find out more about what they do would be useful. Okay, that's super. Thank you, Paul.
No, thank you, Susie. And that's really, really helpful, because I think what it shows is there's an opportunity for a career after you've done your initial qualifications as a podiatrist. Right. Okay. Moving along very, very swiftly. And I've got two colleagues now who are going to talk about those transferable skills that we touched on earlier. And I know colleagues that discussed that. And I'd like to introduce David Watkinson and Rob Lowe, both podiatrists who are both from an armed forces background, who are going to talk about transferable skills. And I'm not sure who's going first. I think, is it Dave going first or Rob? I don't know which. I can't remember which is the next slide deck. So I'm going to hand over to both Dave and Rob.
Dave's first.
Thanks, Paul.
Okay, right. Next slide then, because we need your slide deck. Okay, thank you.
That's me. That's me. Hopefully everybody can hear me. So, as Paul said, my name's Dave Watkinson. I am ex-armed forces. I was in the Royal Armoured Corps, and I became a podiatrist in 1996. Obviously, very different in many ways being a podiatrist to being a crewman in an armoured fighting vehicle. But there are a lot of transferable skills that cross over from the armed forces into NHS and podiatry. So I started as a podiatrist, and then I moved into lecturing at UCL and then here at University of East London. I then moved out of lecturing really into more management as head of department, and then as a director of quality and compliance, which was probably the job most similar to the army in a way. It was almost like being an adjutant. I was in charge of rules and regulations. So I enjoyed that. I thought that was really good, and it linked very much into what I would have done in the army. I'm now back part-time because I will retire in a couple of months' time. I think I've put on my slide there Army's values and NHS values, and there's a difference between them, but there's also quite a lot of similarities there. Respect for others and respect and dignity, integrity, compassion, discipline in the army, commitment to care, but a lot of there around loyalty, commitment, and then NHS values, teamwork, working together, everyone counting. So I think a lot of the values that you have in the armed forces are very similar to the ones in the NHS. And transferable skills, I found that certainly as a student, my work in the army and the skills that I'd got from the army and the values that I'd got from the army held me in really good stead for being a student. So obviously I was very used to turning up on time, being disciplined, meeting deadlines. It always amazed me that if a deadline was there, how many other students couldn't meet that deadline, would have problems. In the army, in the forces, a deadline is a deadline and you meet the deadline. And that I think held me in really good stead as a student, and then also in the NHS. I think Rob will say exactly the same from when he was a student there. And then as moving into the NHS, working as leadership, working as a team, all of those things that you take from the armed forces, and you instill those into the NHS. It is the thing I found most about it was that you are working in a team, but as I'm sure you've heard from the other speakers this morning, you are autonomous. You're an autonomous practitioner. So you're working within a team, you have objectives, but you are also making your own decisions. And that in a way is similar to work in the army. You have an objective as a section commander or as a member of a section or a troop, but you're making your own decisions within that. And I found that really good. I liked working within a team, but also having to rely on my own confidence, my own leadership skills, etc., to do that. I think we are running a little bit behind, so I'll not go on. I'll hand over to Rob for his input as well.
Okay, is Rob on the call? I don't know if Rob.
Yep, here I am.
Yep, brilliant. Okay, over to Rob.
Thanks very much. Thanks, Dave. Yeah, and good afternoon to everybody. Thanks very much for inviting me on. Mine's just a bit of a pretty picture timeline of me. My route into podiatry was very similar to lots of other people, really. The difference with myself was I had a full career. I did 27 years in the Navy, joined in 85, went outside in 2012, and sort of found podiatry by accident. My wife, funnily enough, said she's off to a podiatry open day and wanted me to go along with her. And this was with me probably having about 2 years left to do of an extended career. I went along to see what podiatry was all about, and I was hooked straight away. I spent the vast majority of my career, 22 years, as a PTI and an exercise rehab instructor, and had a deep interest, as Emma was earlier on, as a PTI, interest in musculoskeletal issues, biomechanics, things like that, and it really sort of looking at the Podiatry Open Day, and as everybody's seen today already, the multitude of directions that you can go into really ticked every single box that I could wish for. And as with all of us in the military, the end of our career comes around at some point, and you've got to look at some point as to where you're going to go next. And this really highlighted where I wanted to go. So both myself and my wife left work. I left the Navy and went straight into university. The thing I particularly liked about podiatry is that I could go straight into private practice. And when I graduated in 2015, I bought an ambulance, as you can see it there. I'm based down in Plymouth. And this really driving around in my ambulance was great fun, running my own business, doing my own thing, running my own diary. But I was able to access lots of clientele, lots of patients that other practices perhaps couldn't do, and it worked really well. The other thing I did is move down the picture is when I went into private practice, I joined lots of business networks, and it was a really good way to show podiatry to the masses, with people that perhaps wouldn't have previously experienced it. And there we're shown actually a former W01 Army that's moved into the locksmith business now, doing an assessment on his feet and showing the rest of the business network what it was all about. Subsequent to running the business, I took up, there was some locum opportunity that came around with the MOD, and I did that for about a year, and then went for an interview and got that as a part-time position. So now I work in the regional rehab unit within the military down in Plymouth. It's one of the jobs that I really wanted to know, because when I was an exercise rehab instructor, I'd come across podiatry in the past working within the military, and I thought that might be quite useful. We're MSK specialist podiatrists, and you can see a picture there of some of my colleagues who are also work for MOD. For those eagle-eyed amongst you that probably from the army might identify those steps as coming from the left-hand side of the parade ground at Wellington Barracks. And we go around the country. We provide MSK services to all of the military personnel and MPGS, and are the gatekeepers for non-issue footwear as well. It's a great opportunity. It's a great career. I particularly love it. And as I've said or alluded to, the variety of practice is what drew me to the profession in the first place. And I would recommend it to anybody. As everybody has said, there is so much transferable skills from the military that you'll bring into your podiatry practice. And it's not just for the, it is the right time, right place, right rig, the teamwork, the leadership. But I think the other thing is that generally we are really good with working with people. And I think podiatry is a people game, as are the rest of the allied health professions. But if you can be a people person, you'll build rapport a lot better, and you'll got a lot better history from your patients. And as a result, we'll be able to educate them encourage their concordance with your practices, and I think that's what I found is worked really well. You know, being in the people business and being able to connect and help people and be the best that they can. That's me.
Brilliant, Rob. Brilliant, absolutely brilliant. I think what that's shown is, and this morning I think we've shown it, is the individuals that have come from an armed forces background, where they are now and the opportunities that are available for you. You've taken them and you've just moved at pace to allow that to happen. And I think the healthcare setting is a better place for you individuals from the armed forces. And I don't know, you know, people on the calls would agree with that, but I know working with individuals throughout my career who from an armed forces career, you add so much to the healthcare setting. Anyway, right. So what we're going to move along to now is the events that we're running are aimed not just at those currently serving within the armed forces, but the armed forces community. And that gives us an opportunity to explore and obviously go fishing for spouses and partners, etc. Because as Rob has just shown us, it is possible that other people within your family could become podiatrists. So what we're going to do now is we're going to introduce Jill Woods for it. Now, Jill is a spouse of somebody within the armed force. She's going to explain more. But Jill is actually not with us in this country, from what I understand. So I'm going to pass over now, and hopefully this is going to work. Jill, are you there? We do have a backup plan if this doesn't work. Is Jill around? Is Jill able to come in?
Jill is there, but muted.
Right. Can we come back to Jill? I'm going to try and bring in another colleague now. So we're going to move on to the next slides. And I want to introduce Dan Rigby to you. Dan, hopefully you're there and you can step in for us. Now, Dan represents an organisation within the NHS family called Step Into Health. I'm not going to say any more, otherwise I steal his thunder. So Dan, over to you. And I know you've got a slide deck to present, and we'll try and make contact with Jill. Okay. Thank you, Dan.
Thanks, Paul. Happy to step in. Hello, everybody. Dan Rigby. I'm the Senior Programme Officer for Step Into Health Programme. And I'm going to give you a quick introduction to what we do, who we are, and how we can help you. If we go to the next slide, please. And the next one. So this is our team. We are led by Katie Waller, that's a program lead, and I work alongside Katrina Logan, who is our program assistant. I am a veteran myself. I've worked in the military for 18 years in the Royal Air Force, and I joined the Step Into Health on a 12-week intern program, and now I'm in the role of Senior Program Officer, so I am a product of the Step Into Health program. So next slide, please. Okay, so who are we at Step Into Health? In a nutshell, the Step Into Health program connects candidates from across the armed forces community with employers and opportunities in the NHS. We cover England and Wales, and Scotland has their own version of the program. We were founded in 2014. It was the Royal Foundation, together with the Walking with the Wounded charity, working alongside the NHS in Norwich, giving opportunities for the wounded, injured and sick community of the armed forces, an opportunity to work within the NHS. As you can see on the slide there, who do we support? So we support service leavers, and also veterans, reservists, and the cadet force adult volunteers. And hopefully we'll hear from Jill after this, who is part of the military family. So we also support spouses and children of serving personnel. I've got key transferable skills on there, but I think David and Rob done a really good job of describing those. But they are very under spoken about by us as veterans and service leavers, but all these kind of transferable skills are very much wanted and needed within the NHS. Next slide, please. So how do we reach the community? I think with the audience I've got today, you've made the first step by being on this webinar. So I will concentrate on the candidate system. This is a system that you can register on to create an account. It will ask you for some details, what organisations you're looking to maybe transfer into, and what areas of the country that you're looking to move to or live in. And it will ask you for some key skills and your backgrounds. And what that system will do is will highlight to the geographical area or certain NHS trusts and certain job roles. And what that will do will then prompt an armed forces champion within those organisations to contact you and start that conversation for you. And what will go from there is then they can offer you insight days, work experience, or just a chat to bolster your applications for the roles that you're looking to move into. Other areas on that slide are self-explanatory, but we are trying to get in touch with the whole of the community and various ways that we do that. So CTP, so Career Transition Partnership Fairs, we do 6 a year, and we're currently just signing up to the ones for 2025, with Salford being in February and Bristol being in March. So there's more to come on that. But all this information can be found on our website. Next slide, please. So if you want to get the process started on the candidate system, that is the QR code to do that. All this information will be available after this event. So QR code it now, or we can move on. Next slide, please. So why the NHS? 350 plus career opportunities within NHS. The Health Careers website will give you details of all of those. The employee benefits are very standard, but what I want to pay particular attention to is why the community transitioned to the NHS already. And as you can see there, the culture is number one. The fact that they are a teamwork, ethics-based organisation really lends itself to the skills and attributes that we bring from the armed forces. Benefits are high on the score. Skill set are very suited to career progression in the NHS. Stability and a work-life balance. Next slide, please. So the other side of our job here at Step Into Health is that we get the organisations to pledge to us to support the armed forces community. So currently we actually have 166 as of this week. And what they've pledged to do is to break down the barriers to you as the candidates of transitioning into NHS. So this can be done with insight days, having armed forces champions and a network within the organisation to support you as candidates through the recruitment process, but also whilst you're in your job. Key ones for you, the audience today, would be is starting those conversations with the armed forces champions. What you can do is get some volunteer opportunities or insight days at the organisation, and really will boost your application to the careers that you're looking to do. Next slide, please. So a snapshot of the 350 plus careers within the NHS. I know we're talking about podiatry today, but if you've got family members or colleagues that are looking for another career or a changing career, there literally is all the careers that you can think of, from digital and cyber all through to the doctors and nurses. But more information, as I said, on the Health Careers NHS.uk website. Next slide, please. This is just my guide for yourselves going through the process of applications. These really will help you succeed in what you're looking to succeed in. So make sure you explain in your application how you hit the essential criteria. Now, these are going to be the buzzwords they have in their job adverts, and it's really essential that you do make sure you give examples of where you hit those criteria. We come from a team-based environment, so it's very important that you change we to I. What have you done? How have you achieved something? And how have you made a difference in examples that you provide in your application? Use the contacts that you get through the Step Into Health process. Like we've already mentioned, we're all here to help you through that process. Use us and we can help wherever we can. On applications, there will be an AFI, so that's an Armed Forces Indicator or Identifier. What that does, it benefits you, doesn't disadvantage you at all. This actually notifies the recruiter that you are Armed Forces community. And some of the pledged organisations will actually have a guaranteed interview scheme, whereas if you hit all the criteria that they're looking for, they will guarantee that you'll be part of the shortlist for interview. And lastly, talk and connect. Knowledge is power. It's not what you know sometimes, it's who you know. So have those conversations and use us as a tool to boost your applications. Next slide, please.
I think that's it, Dan. I think that is it. I think
we've actually lost a couple. But yeah, so
right.
all the information's on our website. Thank you for your time today, and any questions, pop them in the chat and I'll answer them as and when I can.
And I think somebody's popped in your QR code that you've been good enough to show. So that's in the chat for people to take. And I really like the bits of advice that you gave about, you know, I rather than we. I think that is important. That is so important when it comes to that important thing. But it's also, people do need to be realised that a lot of the universities now are engaging with the armed forces community. So if you make it very clear that you've got that as a background, then that helps with the application going forward. But thank you very much for your time this morning, Dan. As always, Step Into Health, and we work very closely with them. So thank you very much. Right.
Pleasure.
Okay, as with the news broadcasts, when they struggle to play a video, they always do something else and then they come back. We are going to try Jill again. So is Jill there? Is Jill?
I am.
Oh, brilliant. Right, Jill, I'll now leave over to you. You're going to talk about your role as a spouse to an individual within the armed forces. So over to you. So thank you.
Thank you very much, Paul. Much appreciated. Yes, sorry about that. I'm not a Teams user, so I didn't know where to unmute myself. Anyway, we found it. It's all good, all good. So yes, I have been asked to come along today to talk about my kind of dual life as a podiatry graduate, but also as a military spouse, because my podiatry career has probably been quite atypical in how many different varied roles I've had because of my life, my other half of my life as a military spouse. So I just want to share some of that with you today so that you can see, as everybody already speaking has explained, how varied podiatry can be as a career. I kind of describe podiatry, a podiatry degree, as a golden ticket. I really feel it's something that gives you the opportunity to open so many different doors in so many different ways, and hopefully what I'm about to tell you will really shine a light on that. So I graduated from Huddersfield University back in 1995, which is a very, very long time ago. And I was very fortunate at the time. I did very well in my exams, and I was very fortunate to be offered the role as a clinical associate on graduation. So I stepped sideways straight into a kind of clinical role at the university. And so I kind of broke my teeth in podiatry as an educator, which was fantastic. And I absolutely fell in love with the whole education piece. At the same time, because I was worried about my clinical skills and wanting to develop my clinical skills, the university were very, very generous. And they lent me out to the local NHS. So I worked in the NHS alongside being an educator at the University of Huddersfield for quite a while, until a full-time lecturing post came up at the university, and I jumped with both feet into that. And that was what I was doing alongside running my own private practice. I came into podiatry because I wanted to run a business. That was why I did podiatry in the first place, never expecting to end up in academia and doing that thing. So as soon as I graduated, I started working on building my own practice. And alongside that, I also worked as an associate in another private practice to up my private practice experience. So I was working in the NHS at the university as an associate in another practice and starting my own private practice all at the same time. So I was busy. I was a busy bee, but loved every minute of all of those things. And then I met my husband, who is UK Army, back in 1999. And for a while, I kind of clung on to my old life at Huddersfield, doing all of those things. But then he got a posting down south, and I decided to jump in with both feet as a military spouse and do that. So, but here's where the flexibility comes in. I had already been approached by what was then the Society of Chiropodists and Podiatrists to help them with their marketing podiatry as a career, ironically. Because of my marketing background, I'd worked in marketing and PR before I trained to be a podiatrist. So I came into podiatry with a marketing background. So I was working with the society on a sort of consultancy basis when I did my first accompanied post with my husband down south. And so I kind of was working on that. I started really to understand that my strength lay in teaching, and that also I had a unique experience in being a marketer and a podiatrist. And so I started to kind of plot and scheme how I could combine these things in order to maintain my life as a military spouse, becoming nomadic, but keep me within healthcare and the area of business that I loved. So I started kind of developing some training material. I got invited to talk at the society conference for many, many years. If you've been at a conference, you'll have seen me talk about marketing. And that was going swimmingly right up until the point my husband got a posting to Pakistan. And it was an accompanied posting, and I was given the opportunity of a lifetime, really, to go and spend a year in Pakistan, in southern Pakistan, up in the mountains, near the border with Afghanistan. It was an opportunity that was not going to come around again. And so, again, I jumped in with both feet. And that was when the seed of what is now my business, Practice Momentum, took hold. And I thought, hang on, I've got a really great, strong background in marketing. I've run my own private practice. I sold my private practice to go to Pakistan. I had also, by this point, I went out to Nepal and taught wound care skills in a leprosy hospital in Nepal. Because I had my podiatry degree, I could do that. And I thought, I'm good at teaching. I know marketing. I've owned my own private practice, and it started to kind of stack this idea in my head. At the time, the website, the internet was really taking off. This was 2009, and I thought, I can do this. I can go online and I can use a website to teach practitioners how to market their businesses. And that is what I started doing. So for the last 10 years, when we came back from Pakistan, I have been developing that business in terms of supporting all kinds of healthcare practitioners, not just podiatrists. But because I have run my own private practice, came from a marketing background, I'm a trained educator. I spent my year in Pakistan teaching myself website coding and how to use social media and all of those things to run an offline business that I had at the time as well, a holiday cottage in the Peak District. So, but my podiatry degree has been the common denominator through all of these things. It enabled me to go to Nepal. It enabled me to be a university lecturer. It enabled me to run a private practice. It enabled me to work in the NHS. And now it's enabling me to run Practice Momentum. And so I really wanted to just have this opportunity to explain as a spouse who can't practice that having a podiatry degree doesn't mean you have to be a podiatrist, but it still opens doors and it still enables you to have this incredibly flexible career. My time in Nepal was when my husband was away on a op tour. So I went for 6 months to Nepal when he went for 6 months to Iraq. And so this whole journey with him and my podiatry career has been enabled because of the flexibility and the diversity within podiatry as a career. So yeah, I just really wanted to make that point that it's such a valuable qualification in terms of building what is now called a portfolio career, I think. But it's just so valuable, so rewarding, so fulfilling, and it really gives you this opportunity to make of what you want out of a career. And I say you don't actually have to be a podiatrist to work in podiatry with a podiatry degree.
Brilliant, Jill. Thank you. And I agree with you. Yeah, sometimes it's your qualification that allows you to blossom and expand. Well, thank you very much. We got there in the end with the technology and the issues of it, but we do appreciate the advice and the support that you've given from that perspective. Right. Okay, so what we're going to do now is we're going to move on to our universities, and we're going to give our university colleagues the opportunity to chat to us. And what I want to do now is I want to bring on colleagues from the various universities. I'm going to start off with the University of East London. They are colleagues that are first on my slide deck. So Jill, if you want to pop yourself on mute and switch your camera off, then that will be really helpful. And I'd like to bring in colleagues from University of East London. Yuransu, are you there?
Yep, I'm Paul, I'm ready.
Right, brilliant. Okay, off you go then. So next slide then for that. Okay, so.
Thank you. I'll be nice and brief. I've only got one slide. Hi everyone, it's nice to be here speaking to all of you today. I'm just going to run briefly through the courses that we offer here at East London. So we offer the traditional undergraduate degree, which is split over 3 years, and we also offer the apprenticeship route, which is over 4 years rather than 3. So the traditional route is a full-time course which combines theory and practical-based learning at the university, and then block placements in one of the trusts that we work with in London or the southeast of England. However, we're not limited to those areas. We have had students placed in Wales and Scotland, so if you would like to go further afield, we can absolutely make that work as well. Then we have the apprenticeship course, which, as I've said on the slide, we have a split of 40% off the job learning, which involves 1 day at university, 1 day of personal study, and then 60% of your time where you will be employed by an NHS trust, and you will be able to spend time there as a podiatry assistant, learning on the job. This is something that we started at University of East London about 5 years ago, and it has worked really well. The apprentices that graduated last year were our first cohort, and they have really been really successful. They went into band 5 jobs and they're already now in band 6 jobs, which is great. And then also just wanted to make sure that you knew that there's many diverse ways of getting into podiatry, as you've learned today. So please feel free, and I have put at the bottom of the slide, hopefully it'll pop up in a second, the contact details for myself and my colleague Jill, who's our admissions tutor. You are very welcome to come and spend a day with us here. if you would like to see how our classes run, and you can also contact us if you would like to have a meeting. And if you would like to discuss your personal circumstances, we can absolutely have that conversation. So I think my details are at the bottom of that slide. If not, I will add them. Yeah, perfect. Thank you so much. And yeah, please reach out. You might think that you're not able to come into university. You might think you don't have the qualifications. We can guide you with that. If you don't have the right qualifications, we can point you in the right direction. So please get in touch and have a chat with us. Thank you.
And no, that's brilliant. And again, I think it's showing that there are lots of opportunities there. You know, don't dismiss it just because it's university. It's a life studies. That's what we're looking at. Brilliant. Okay, yeah. Right. So next on my list, I have New College Durham. So over to New College Durham, and off you go.
Hi there. Hello.
Hello, everybody. You've got two for the price of one today. So I'm Tracy Walker. I'm the curriculum manager for the programme, and Alison's the programme lead. So we've both popped on to have a quick chat with you today. Could you just move on to the first slide for us, please? Brilliant. Thank you. And
can you just click it again? That's great.
Excellent.
So I just want to mention our entry requirements. We ask for 64 UCAS points and GCSE Maths and English, or a level 2 in functional skills. Obviously, you can get your UCAS points from lots of different routes. We do tend to look at the individual though. We're like a mixed economy college, and there's a lot of support for people who haven't done academic study before. So we can offer a lot of help to individuals, and we like to meet the individual. They usually attend an informal interview, and we'll take lots of things into account when we're deciding who's going to come onto our course. Can you move on to the next slide, please? So just a bit about the course. I think me and Tracy just say a bit of both about this. Yeah. We do the course over 3 days, so you can work in employment as well around if you need to boost your finances. We do have face-to-face delivery. We have our own dedicated clinics. So in your first 2 years, you would spend 1 day a week in clinic, and in your third year, you would spend 2 days a week in our clinic. But we do offer NHS placements as well at various trusts around the northeast. We do placements with Harrogate and Cumbria we've had in the past.
Yeah, we have 10 or 12 different NHS providers that take our students on placement, so you can be placed in a whole range of different areas. Accommodations covered as well in that type of thing if you're away from home for that. And in our level 4 first year of the programme, it's for 1 week. In the level 5 second year, it's for 1 week, and then in level 6, no, it's for 2 weeks, sorry, in level 5, but different times throughout the year, and then 2 different weeks throughout level 6 as well. The rest of the hands-on practical experience comes from our own clinics that we have on site here. So we have 20 chairs altogether, more roughly, in our clinical site, split over 2 areas, and the students spend a lot of time on a weekly basis in our clinical site as well, having hands-on experience doing the nail surgery that you've watched earlier, and all the other treatments involved.
And also the staff that teach you in the classroom also teach you in the clinic as well, so we can transfer that theory across to practical skills.
Yeah, and as Alison said, I think just to finish off with, there's a lot of support for people that have been out of study for quite a long time. A lot of our students that come onto the programme tend to be more mature students. We don't get as many sort of A-level leavers as we do mature students looking for a second career. So it's a lovely place to study with lots of support, and a nice area to be in as well.
Yeah, get that bit in.
Yeah, get that bit in. I don't think we didn't add our contact details onto that slide, so I'll pop them into the chat as things are going, so that anybody's got them if they need them. Is that okay?
No, that's brilliant. Thank you very, very much. We really do appreciate.
Thank you.
Jill, did you want to switch your camera off because you're actually on, still being viewed? So Jill, if you want to switch your camera, that would be right. Next up is University of Plymouth. So we're going from one part of the country all the way down to another part of the country. So my colleagues from Plymouth, over to you.
Yeah, hi folks. My name is Phil Hendy. I'm academic lead for the Podiatry programmes we run at the University of Plymouth. Well, I just realised this morning when I put this slide deck together, I actually forgotten to talk about our standard degree. So I'll present to you our apprenticeship programme first, and I'll talk quickly about our standard route as well. So if you flick to the next slide, please. So we run apprenticeships at the University of Plymouth, and our apprenticeships are validated by the HCPC. They're also endorsed by the Royal College, and in fact we are Health Education England's preferred provider of podiatry apprenticeships in England because of the innovative model that we've used to develop and deliver our programmes. Next slide, please. So for our apprenticeship programme, we run 2 routes into the profession. So we run our traditional 3-year BSc entry, so that's an undergraduate programme where apprentices are employed for a minimum of 30 hours a week. And of that 30 hours, they have protected time, which works out roughly a day a week. One of those days is spent with us online learning. Our apprenticeship programmes are delivered completely at distance. So you can access the programme wherever you are in England, because there is no requirement at any point for you to come down to Plymouth, because we deliver the programme at distance. So we have one day for online learning, and then a further 1 day where you work under the supervision of your clinical educators, developing the psychomotor clinical skills that you require for the profession. And we also then run a 2-year fast track pre-reg MSc for those applicants that come across to us that already hold a degree level qualification. Again, minimum requirement of 30 hours a week in employment. But for the MSc students, they have 40% protected time for their online learning, so that's 2 days a week, and a further 1 day a week under supervised clinical practice within the workplace. Next slide, please. So you can see here on the screen the entry requirements, which fundamentally for the undergraduate programme we need to see Maths and English at GCSE grade 4 or C, or functional skills level 2. A GCSE in science is desirable but not essential, and then we need to see some evidence of a level 3 qualification. That's the same for the MSc, however we need to see a degree within that as well. And it would just be worth mentioning at this point that the University of Plymouth have been doing a long-standing piece of work around non-standard qualifications for people such as armed forces leavers. So we are very flexible in our approach of what we can use as qualifications. In fact, we've got a chap that started on our first year of our standard degree programme this year that has come from the armed forces, and pretty much all of his qualifications were non-standard qualifications that we were able to map against what you would consider to be a formal qualification, and now he's on our programme and enjoying his first year. So that's a nice thing to be able to say at this meeting. Next slide, please. So you can see here, this is how we deliver our apprenticeship programme, which is, as I've mentioned, 100% virtual delivery, so you don't need to come to Plymouth or live in Plymouth to access the programme. You have various amounts of live teaching per week, which we do via Zoom, highly directed study tasks to prepare you for the live teaching sessions, and all of your placements are with your employers. We assess you at the university for your theory content, so exams, academic pieces of coursework, presentations, and so on. All of that stuff comes back to us at the university to mark, and your clinical skills are assessed within the workplace with an electronic portfolio. Next slide. So those are the contact details on there. If you're interested in our apprenticeship programme, you've got the contact details for the apprenticeship team, and those are my details there if you wanted to discuss anything relating to podiatry at Plymouth. And before I finish, I'll just mention that of course we run a traditional 3-year undergraduate programme at the university, where you would come down to Plymouth and you would spend your time on campus to develop your underpinning theoretical understanding of the programme. We then have in-house training facilities where we develop your clinical skills, and then you will go out into the NHS for all of your placements. So you'll have placements first year, second year and third year, all within our local NHS services, kind of within the southwest. However, same as others on the call, we are able to offer placements wider than that if we need to. So traditional degree if you want to come down to Plymouth and study, or you've got your virtual apprenticeship options as well. But yeah, if you want any information, give me a shout, or you can check out our website. They'll have all that information as well. Thank you.
Thank you, Phil. And I think it's great what you've said there about, taking people on may not meet the minimum requirements, but work with them, get them to understand what they've got in their toolbox, as I would say. And there's no reason why they can't go on to study within that arena and become podiatrists. So it's great news.
Yeah,
and I know
absolutely. It's a really nice piece of work that's been done around those non-standard qualifications, because people come out of the armed forces with such a wealth of experience and knowledge. It's great that we can actually use that and apply it into higher education settings.
And that's something that we've really tried to drive forward within NHS England. And that was a piece of work that we commissioned going forward. And I know Plymouth were really supportive of that. So thank you very much going forward. Right. Next on my list, we have Derek back. Derek is back for a second spell to talk about quick work in Scotland.
Hi, thank you, Paul. As I say, in Scotland, at Cumbernauld University, we offer two programs. We offer a Master of Podiatry, which is a 4-year program, as well as a BSc of Podiatry, which is a 4-year program. All students will start on the Masters of Podiatry, and at level 2, year 2, students are given the choice to either continue on the Masters program or switch to the BSc route. The difference is obviously for the next 2 years, you will be assessed at master's level and you will take in additional modules. On average, students take about 6 modules, but sometimes with the masters, you may be taking 8 modules per year. In terms of interdiscipline working, which is part of standard NHS, working, we do have various modules that are shared across the division between radiography and podiatry, so you can start your interdiscipline learning and working with other professions within the program. And there are also podiatry specific modules. In level 1, there are pre-placement clinical modules, and you do go on placement from level 2 onwards. Placements are throughout Scotland, but we also have our own clinics within the university, where you will start those from level 3 and 4. Next slide, please. In terms of entry qualifications, we're looking for 3 Cs at A level, and in terms of your and also we're looking for sort of GCSE Maths and English, sorry. Now, I do understand that there are non-standard qualifications, and you can contact our admissions tutor for further information. There are also swap courses that link into the program, and they are access courses. Some of the access courses will allow you to step into level 2 of the BSc program. Next slide. If you require any further information, there's a QR code which takes you to a website, and you can actually find further information on the 2 programs. If you want to discuss any non-standard qualifications or how to enter our program, you can contact Neil Pomfret, who is our admissions tutor. Thank you.
Thank you. Thank you very much, Derek. That's really, really helpful. And yeah, it's great to have the contact details as well going forward. Right. Okay. Moving along very swiftly, we now have our colleagues from the northwest of England, from the Salford area. So, Gilly, over to you.
Hi, everybody. What I'm not going to do is tell you again all about the different qualifications, because I think the differences between the programs and the qualifications are so small. What I would say, you'll have the slide deck afterwards, and you're more than welcome to come and visit us. But I'm not sure what Saul Hill mentioned, but I was the person who actually recruited Saul, and he came to me as a young person. Still, he'd only just done some GCSEs, and he was interested in leaving the army and looking at a different career. And from podiatry, I think you've probably seen what can be achieved. And David and Rob put it so succinctly that the transferable skills from armed forces leavers are brilliant. And I'm sure every admissions tutor on this call will tell you that we've always admired and appreciated the skills that you have and welcome you on our course. If you just flick through my slides, there's one slide that said, if you've got non-traditional qualifications, if you flick through it, I think it's highlighted in red towards the end. You just must get in touch with somebody, even if it's not my uni and it's one of the other unis, because what we can do is we can map using the accreditation of your prior learning and give you an offer of a place, because we just appreciate what you have got rather than what you haven't got. So that's as much as I'm going to say. You have my details in the post at the end, and I wish you good luck. Please, if you need any information from any of us, just get in touch with us.
I love that last slide. It's brilliant, absolutely brilliant. And Jilly, thank you very much. You're right. Again, it's great to see another university saying, look, come and talk to us, because there are endless opportunities. And that's the most important thing. At the end of the day, this cohort of individuals have got so much to bring to the agenda going forward.
Absolutely.
So thank you. Thank you very much, Salford. It sounds a little bit like the Eurovision list does. Right, now we're going to move across to our last, which is Brighton. And Brighton have already helped us today with Emma. So it's now over to Brighton and colleagues from Brighton, if you'd like to give us an update on what Brighton has to offer.
Hello, good afternoon. My name's Christine. I'm one of the lecturers in the podiatry team. I think firstly, I'd sort of second what Jilly's just said, and I won't go back through the admission. I know we're tight on time now. But we offer two different courses at Brighton. We offer a BSc full-time over 3 years and the pre-registration MSc, which is run over 2 years. I know Paul said that you didn't want to know lots about the city, but I think part of the university's attraction is the city, and I think the university very definitely reflects that. And actually, when I asked Emma why she came here, that was one of her reasons. So I think it's valid in there. I mean, as Jilly said, you know, the universities, there's lots of similarities in different ways. I think some of our aspects that I'd like to hone in on are things around our placements. We have quite a diverse range of placements. We go out on placement from week 7 on both courses, and that's supported by a local NHS trust. After that, we get lots of opportunity for leadership, education placements. We've had lots of students out on international placements this year. Excuse me, this year, talking too fast. And our students get opportunity for things like the Brighton and London marathons. Can we go to the next slide, please? Okay, so I just wanted to talk a little bit about support and assessment. I think the university's got lots and lots of support in place. We've got the SSGT team, there's academic support. We mentioned much earlier in the day about learning support programs and plans for people who have learning needs. We also offer varied modes of assessment, which obviously are inclusive to learning, and some modules actually have a choice of assessment mode, which is good for people with different learning needs. I think the other stuff is on there, so, you know, very much career focused. Over 90% of graduates secure a job after graduation. And any questions, you'd be welcome to get in contact. I haven't popped mine in there, but I will pop it in the chat now. Thank you.
Thank you very much, Christine. And it's always hard to go last, isn't it? Because everybody else steals your thunder, as I think others found earlier. But we do appreciate, and obviously Brighton today have supported in the form that they would put forward Emma, who's dutifully obviously sold Brighton, I think, in the way in which she was able to say about her studies. So thank you very much. And yes, Brighton is a lovely place to visit and study at the end of the day, but I think everybody knows what I was talking about when I was saying not to sell the venue, but more the university and what it had to offer. Brilliant. Okay, next slide, please. So there we go. You've learned today about the career that is an opportunity for you in podiatry. We've learned that podiatry is one of the 14 allied health professions that is available to you. We've learned about what podiatry is and the variety of areas of podiatry that are open to you. We've learned about the route into the podiatry, how to gain it, and then we've heard from universities what you need to do to be able to go off to study. More importantly, we've learned about the lived experience, those individuals who have been in the armed forces and now are podiatrists. We had Jill talk about how as a spouse you can actually study as a podiatrist and the opportunities that are there for you as a career. But more importantly, we've actually seen podiatrists in action with our colleagues from Guy's and St Thomas's, who gave up their time to show what it's like to do podiatry work on a day-to-day basis. Hopefully, if this has inspired you to look at podiatry as a career, then you'll go away, you will make contact with the relevant people that we've put you in contact with. If you need to explore it a little bit more, remember there is the Royal College of Podiatry, which is the professional body and can support you. But most importantly, it's about making contact with those universities. My name's Paul Chapman. I'd like to thank you for your time today, and hopefully you will progress and you'll pick up a career in podiatry. Thank you.